Apa yang menjadikan suatu program-program yang baru dalam rangka pemenuhan pasar ini akan menjadi Setia Malang akan menjadi lebih eksis sehingga semua kebutuhan pasar bisa dipenuhi oleh Setia Malang. Saya Dr. Andes HM Trivianto MSI alumni Malang yang juga sekaligus sebagai Ketua Ikatan Alumni Mahasiswa Setia Malang.
Setia Malang menurut saya adalah sekolah tinggi yang mempunyai inovasi di dalam menciptakan lapangan pekerjaan terutama di bidang kesehatan, yaitu menciptakan tenaga-tenaga yang terampil di bidang rekam medis. Kurikulum di Setia Malang terutama di bidang rekam medis adalah sudah sesuai dengan standar yang diberlakukan. Setelah lulus dari Setia Malang, saat ini saya bekerja di Rumah Sakit Panti Nirmala sebagai Kepala Rekam Medis. Saya R.A. Sunaryati, AMD RMIK, alumni Setia Malang.
Kesan yang saya peroleh selama menempuh pendidikan di Setia Kota Malang yaitu tempat atau fasilitas pendidikannya sangat mendukung sekali dalam proses belajar dan mengajar. Demikian juga dengan dosennya sangat berpengalaman sekali, sehingga materi yang diberikan itu sangat menunjang, sangat membantu dalam proses melaksanakan tugas sehari-hari. Sekarang saya menjabat Sekretaris Badan Perencanaan Pembangunan, Penelitian dan Pengembangan Daerah Kota Batu. Sangat bangga menjadi bagian keluarga besar Setia Kota Malang.
Halo teman-teman, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan salam sehat untuk kita semua. Perkenalkan, nama saya Ibu Eka Agustining Tias. Saya dosen tetap yayasan di Sekolah Tinggi Ilmu Administrasi Malang pada Prodi Ilmu Administrasi Bisnis. Oke, salam sayang ya guys. Ada pepatah, tak kenal maka tak sayang. Apa ada nih yang sudah tahu Setia Malang? Ups, tunggu dulu ya, administrasi jangan diartikan hanya sekolah tata usaha loh. Kalau Anda mengira seperti itu salah besar ya. Dalam arti luas, administrasi merujuk pada kegiatan atau usaha untuk membantu, melayani, dan mengatur semua kegiatan di dalam mencapai suatu tujuan, baik yang berkenaan dengan kegiatan pemerintahan maupun dalam kegiatan usaha atau bisnis, serta rumah sakit maupun puskesmas. Nah, sekarang sudah paham kan semboyan kami small is beautiful. Indah dalam arti apa ya? Indah dalam arti biaya yang terjangkau, tapi bukan murahan loh, karena kita unggul dalam mutu, terjangkau dalam biaya. Kemudian indah kampusnya. Kampus kita ini hijau, bersih, nan asri loh, pasti bakalan betah deh kuliah di sini. Yang terakhir, indah dalam fasilitas dan dosennya. Fasilitas kita lengkap loh, ada lab bahasa Inggris, lab komputer, lab akuntansi, kemudian ada lab otoda, berikut klinik kesehatan, tempat ibadah, serta unit kegiatan kemahasiswaan. Selain itu, dosen-dosennya keren-keren loh dan pastinya ahli dalam bidangnya. Nah, kita ada 4 program studi nih yang kami tawarkan di kampus Setia Malang. Yang pertama, program pasca sarjana yaitu Magister Ilmu Administrasi dengan minat studi yaitu Administrasi Negara dan Administrasi Bisnis. Kemudian yang kedua ada program sarjana yang terdiri dari 2 prodi. Ada program studi Administrasi Negara. Nah, ini prodi yang cocok untuk kalian yang ingin berkarir di bidang pemerintahan, seperti ingin menjadi bupati, wali kota, gubernur, atau di kantor pemerintahan. Kemudian ada prodi administrasi bisnis. Kalau yang ini cocok untuk kalian yang berkarir di bidang bisnis. Misalkan pengen berkarir di bidang perbankan, properti, perusahaan BUMN, maupun menjadi entrepreneur sejati. Selanjutnya, program vokasi yaitu Diploma 3 Berekam Medis dan Informasi Kesehatan. Prodi ini juga saat ini paling hits dan dibutuhkan dari rumah sakit maupun puskesmas di seluruh Indonesia sebagai persyaratan akreditasi untuk rumah sakit dan puskesmas. Prodi ini juga dipersiapkan bagi Anda sebagai pengelola data rekam medis di rumah sakit maupun puskesmas. Nah, sekarang sudah jelas kan? Jangan lupa kita juga ada program beasiswa KIP Kartu Indonesia Pintar. Tentunya program beasiswa ini Anda dapatkan sampai dengan lulus perkuliahan. Kemudian ada program beasiswa UKT. Ini Anda akan bebas SPP selama 1 semester. Kemudian kita juga punya lagi loh diskon untuk uang gedungnya. Ada diskon 20% untuk gelombang pertama dan diskon 10% untuk gelombang kedua. Yuk, siapa cepat dia yang dapat. Mari bergabung bersama Sekolah Tinggi Ilmu Administrasi Malang.
Sekolah Tinggi Ilmu Administrasi atau STIA Malang berdiri pada Juni 1981 di bawah Yayasan Pendidikan Majapahit Malang. Pada tahun 1992, STIA Malang mendapatkan kepercayaan dari pemerintah dan memperoleh status disamakan dan telah terakreditasi oleh Badan Akreditasi Nasional Perguruan Tinggi. Selama perjalanannya, STIA Malang pun juga telah banyak mengukir kemajuan dan perkembangan di berbagai bidang, baik dari segi pendidikan, sarana prasarana. Sebagai sebuah perguruan tinggi ternama, STIA Malang memiliki visi mewujudkan Sekolah Tinggi Ilmu Administrasi sebagai perguruan tinggi yang terkemuka bertaraf nasional dan internasional di bidang pendidikan, penelitian dan pengabdian kepada masyarakat. Sebagai lembaga pendidikan ternama dan terakreditasi, STIA Malang memiliki misi menyelenggarakan kegiatan belajar mengajar secara kreatif dan inovatif dalam rangka pengembangan ilmu pengetahuan dan teknologi, menyelenggarakan penelitian secara kreatif dan inovatif untuk mengembangkan ilmu pengetahuan yang bermanfaat bagi kesejahteraan umat manusia, serta menyelenggarakan kegiatan pelayanan atau pengabdian kepada masyarakat secara optimal melalui tindakan nyata yang bertanggung jawab. STIA Malang ialah Program D3 Perekam Medis dan Informasi Kesehatan, Program Sarjana Administrasi Negara, Program Sarjana Administrasi Niaga, serta Program Pasca Sarjana Magister Administrasi Negara dan Program Pasca Sarjana Magister Administrasi Niaga. Guna memantapkan kegiatan Tridharma Perguruan Tinggi, Sekolah Tinggi Ilmu Administrasi Malang yang berada di bawah naungan Yayasan Pendidikan Majapahit telah memiliki 6 gedung yang didirikan di atas lahan seluas 1 hektar dengan banyak fasilitas penunjang, di antaranya ruang kuliah yang dilengkapi dengan ketersediaan ruang kuliah lengkap dengan berbagai fasilitas untuk menunjang proses pembelajaran, ruang seminar untuk fasilitas dosen dan mahasiswa yang akan melakukan seminar hasil-hasil penelitian maupun pengabdian terhadap masyarakat. Aula dengan luas 1000 meter persegi yang selalu terjaga keindahan serta kebersihannya. Gedung perpustakaan yang dilengkapi dengan beragam buku sesuai dengan kebutuhan masing-masing program studi, e-book, jurnal, dan masih banyak lainnya. Ruang laboratorium yang terdiri dari 2 laboratorium komputer, laboratorium bahasa Inggris, laboratorium akuntansi dan otoda, poliklinik yang ditunjang dengan beragam peralatan medis pendukung serta didukung oleh dokter berpengalaman, laboratorium rekam medis, lapangan olahraga yang biasa digunakan mahasiswa sebagai lapangan basket dan voli. Ruang kegiatan mahasiswa, di antaranya IDAIS, Mahapala, Himaris, HMJ, RPS, PMK, dan Himpora. Selain itu juga ada fasilitas penunjang berupa musola dan kantin. Sebagai salah satu lembaga pendidikan terkemuka, STIA Malang tentunya memiliki beragam keunggulan. Salah satunya ialah mengimplementasikan berbagai sistem informasi, antara lain sistem informasi akademik Sevima Go Feeder Cloud, sistem informasi keuangan, sistem informasi SDM, serta beragam sistem informasi lainnya untuk menunjang kegiatan peningkatan pelayanan dan juga pembelajaran yang ada di kampus. STIA Malang juga banyak menggelar kegiatan untuk memantapkan skill para mahasiswa dan kompetensi lulusannya, maupun sebagai kegiatan wajib rutin. Beberapa di antaranya ialah proses penerimaan mahasiswa baru, proses pembelajaran melalui perkuliahan, ujian tengah semester, UAS, praktikum, praktik kerja lapangan atau magang, pemaparan hasil PKL, penulisan TA dan tesis, serta ujian komprehensif atau ujian akhir program. Penelitian dan pengabdian masyarakat yang dilaksanakan dengan melibatkan mahasiswa. Salah satu kegiatan yang rutin digelar setiap tahunnya ialah ospek, kegiatan wajib yang diselenggarakan untuk memperkenalkan mahasiswa baru dengan lingkungan kampus STIA Malang.
Nama saya Viola Ribet Agustina, saya biasa dipanggil Viola, saya berasal dari SMA Negeri 1 Nganjuk. Saya memilih sekolah di sini karena tidak semua sekolah mempunyai jurusan reka medis dan informasi kesehatan. Saya berasal dari keluarga pekerja swasta dan saya bangga menjadi mahasiswa setia Malang.
Nama saya Jistitia Putri Wirana Septia, biasa dipanggil Tia. Saya berasal dari MAN 1 Kota Malang. Alasan saya belajar di STIA Malang adalah karena saya ingin lebih menekuni ilmu administrasi bisnis. Saya bangga menjadi mahasiswa STIA Malang.
Perkenalkan, nama saya Abner Raya Dekubani, biasa dipanggil Abner. Saya berasal dari Sumba Barat Daya. Tujuan saya masuk ke STIA ini karena biaya administrasinya menjangkau. Saya bangga jadi anak STIA.
Perkenalkan, nama saya Marta Inakaka, biasa dipanggil Mita. Saya alumni dari SMA Santo Alfonsus. Saya berasal dari Sumba Barat Daya. Saya kuliah di kampus STIA Malang karena biayanya sangat terjangkau. Saya bangga menjadi siswa STIA Malang.
Ujian semester yang selalu digelar di akhir semester untuk mengevaluasi sejauh mana para mahasiswa menguasai materi perkuliahan yang mereka dapatkan selama 1 semester. Pemaparan hasil PKL yang dilakukan oleh para mahasiswa yang telah menjalani praktik kerja lapangan. Pada kegiatan ini mereka akan memaparkan serta melaporkan kegiatan dan ilmu yang mereka dapatkan bersama teman-teman di masing-masing lokasi PKL. Yudisium yang merupakan proses penilaian akhir dari seluruh mata kuliah yang telah diambil mahasiswa guna memutuskan lulus atau tidaknya mahasiswa dalam menempuh studinya. Sumpah Profesi, kegiatan khusus untuk lulusan Diploma 3 ini digelar sebelum para mahasiswa dilepas ke dunia kerja, sehingga mereka akan menjadi tenaga kerja yang profesional dan bertanggung jawab. Pada kegiatan ini mereka pun akan bersama-sama mengikrarkan sumpah dengan didampingi pemuka agama. Tak hanya kegiatan-kegiatan yang bersinggungan langsung dengan pendidikan maupun pembelajaran di perkuliahan, namun beragam kegiatan yang berimplementasi pada soft skill ketika para mahasiswa terjun ke masyarakat juga banyak digelar, seperti seminar nasional, diklat, workshop, praktik kewirausahaan, dan berbagai kegiatan kemahasiswaan lainnya. Kegiatan-kegiatan tersebut tentunya bermanfaat untuk meningkatkan kompetensi maupun skill lulusan, sekaligus sebagai lahan praktik.
Sekolah Tinggi Ilmu Administrasi Malang menurut saya merupakan suatu sekolah tinggi ilmu administrasi yang swasta, tetapi tetap eksis karena Sekolah Tinggi Ilmu Administrasi Malang ini menyikapi kebutuhan pasar. Ya, apalagi saat ini dengan adanya tambahan dari program D3 yaitu rekam medis yang saat ini benar-benar sangat dibutuhkan. Sehingga dengan adanya apa yang menjadikan suatu program-program yang baru dalam rangka pemenuhan pasar, ini akan menjadi STA Malang akan menjadi lebih eksis, sehingga semua kebutuhan pasar bisa dipenuhi oleh STA Malang. Saya Dr. Andes HM Trivianto MSI, alumni Malang yang juga sekaligus sebagai Ketua Ikatan Alumni Mahasiswa STA Malang.
STA Malang menurut saya adalah sekolah tinggi yang mempunyai inovasi di dalam menciptakan lapangan pekerjaan, terutama di bidang kesehatan, yaitu menciptakan tenaga-tenaga yang terampil di bidang rekam medis. Kurikulum di STA Malang, terutama di bidang rekam medis, adalah sudah sesuai dengan standar yang diberlakukan. Setelah lulus dari STA Malang, saat ini saya bekerja di Rumah Sakit Panti Nirmala sebagai Kepala Rekam Medis. Saya R.A. Sunaryati, AMD RMIK, alumni STA Malang.
Kesan yang saya peroleh selama menempuh pendidikan di STA Kota Malang yaitu tempat atau fasilitas pendidikannya sangat mendukung sekali dalam proses belajar dan mengajar. Demikian juga dengan dosennya sangat berpengalaman sekali, sehingga materi yang diberikan itu sangat menunjang, sangat membantu dalam proses melaksanakan tugas sehari-hari. Sekarang saya menjabat Sekretaris Badan Perencanaan Pembangunan, Penelitian dan Pengembangan Daerah Kota Batu. Sangat bangga menjadi bagian keluarga besar STA Kota Malang.
Halo teman-teman, Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan salam sehat untuk kita semua. Perkenalkan, nama saya Ibu Eka Agustining Tias. Saya dosen tetap yayasan di Sekolah Tinggi Ilmu Administrasi Malang pada Prodi Ilmu Administrasi Bisnis. Oke, salam sayang ya guys. Ada pepatah, tak kenal maka tak sayang. Apa ada nih yang sudah tahu STA Malang? Ups, tunggu dulu ya, administrasi jangan diartikan hanya sekolah tata usaha loh. Kalau Anda mengira seperti itu salah besar ya. Dalam arti luas, administrasi merujuk pada kegiatan atau usaha untuk membantu, melayani, dan mengatur semua kegiatan di dalam mencapai suatu tujuan, baik yang berkenaan dengan kegiatan pemerintahan maupun dalam kegiatan usaha atau bisnis, serta rumah sakit maupun puskesmas. Nah, sekarang sudah paham kan semboyan kami, small is beautiful. Indah dalam arti apa ya? Indah dalam arti biaya yang terjangkau, tapi bukan murahan loh, karena kita unggul dalam mutu, terjangkau dalam biaya. Kemudian indah kampusnya, kampus kita ini hijau, bersih, nan asri loh, pasti bakalan betah deh kuliah di sini. Yang terakhir, indah dalam fasilitas dan dosennya. Fasilitas kita lengkap loh, ada lab bahasa Inggris, lab komputer, lab akuntansi, kemudian ada lab otoda, berikut klinik kesehatan, tempat ibadah, serta unit kegiatan kemahasiswaan. Selain itu, dosen-dosennya keren-keren loh dan pastinya ahli dalam bidangnya. Nah, kita ada 4 program studi nih yang kami tawarkan di kampus STA Malang. Yang pertama, program pasca sarjana yaitu Magister Ilmu Administrasi dengan minat studi yaitu Administrasi Negara dan Administrasi Bisnis. Kemudian yang kedua ada program sarjana yang terdiri dari 2 prodi. Ada program studi Administrasi Negara. Nah, ini prodi yang cocok untuk kalian yang ingin berkarir di bidang pemerintahan, seperti ingin menjadi bupati, wali kota, gubernur, atau di kantor pemerintahan. Kemudian ada prodi administrasi bisnis. Kalau yang ini cocok untuk kalian yang berkarir di bidang bisnis. Misalkan pengen berkarir di bidang perbankan, properti, perusahaan BUMN maupun menjadi entrepreneur sejati. Selanjutnya, program vokasi yaitu Diploma 3 Berkah Medis dan Informasi Kesehatan. Prodi ini juga saat ini paling hits dan dibutuhkan dari rumah sakit maupun puskesmas di seluruh Indonesia sebagai persyaratan akreditasi untuk rumah sakit dan puskesmas. Prodi ini juga dipersiapkan bagi Anda sebagai pengelola data rekam medis di rumah sakit maupun puskesmas. Nah, sekarang sudah jelas kan? Jangan lupa kita juga ada program beasiswa KIP Kartu Indonesia Pintar. Tentunya program beasiswa ini Anda dapatkan sampai dengan lulus perkuliahan. Kemudian
Ladies and gentlemen, please welcome dance performance from Rumpun Seni Sekolah Tinggi Ilmu Administrasi Malang. The dance that will be present is Nusantara Dance. Nusantara Dance consists of Sik-Sik Batu Manikam Dance, Sipatokan Dance, Sajojo Dance, Tanda Ganjen Dance, The Kecak Dance, and Poco-Poco Dance. Sik-Sik Batu Manikam Dance is a dance originating from the Batak region of North Sumatra. The dance tells about the atmosphere of the ancient Batak tribal party hundreds of years ago. Sipatokan Dance is a regional dance originating from the North Sulawesi. The songs of the Sipatokan, which has a rhyme narrative pattern, is an expression of the love and worry about mothers for her child. Sajojo dance is a dance originating from the easternmost island of Indonesia, aka Papua. The dance is free to be performed by anyone, both men and women. Nanda Ganjen dance is a dance originating from Betawi. This dance describes the atmosphere of growth and association of young Betawi girls who tend to be lively. The Kecak dance was created by a Balinese artist and German painter. The Kecak dance tells about wayang, especially Ramayana story, which is performed with the art of movement and dance. Poco-poco dance is a song originating from Maluku. The term poco-poco is for an adorable plump, cute baby. Please welcome and enjoy the performance.
Ladies and gentlemen, please welcome Master of Ceremony, Lutfia Latifah.
Good morning, everybody. Assalamualaikum warahmatullahi wabarakatuh. Welcome to all participants from Indonesia, Malaysia, Australia, Philippines, Oman, India, Qatar, Jamaica, and Japan. Well, thank you for the participating in the international seminar. Good morning, ladies and gentlemen, and best wishes for all of us. And the Honorable, the Chairman of Majapahit Education Foundation, Professor Dr. Taher Alapsi, the Chairman of Setia Malang, Dr. Insinyur Ali Hanafiah MM, Head of D3 Medical Record and Health Information Study Program, Mrs. Suhartina SAMM, the Chairman of East Java Pormiki Branch, Mrs. Ana Rosarini AMD PK SHMH, and all of the speakers at International Medical Record and Health Information Seminar 2021. The Honorable Mrs. Vicky Bennett as Head of Metadata and Classification Unit at the Australian and Institute of Health and Welfare. Dr. Sililo R. Amihan as Leader in Professional Organization Distinguished Research Expert, External Consultant in Education and Research. Mr. Johari bin Mohamed as Head of Department Medical Record Sultan Abaya Hospital, Malaysia. Dr. Sililo R. Amihan as Leader in Professional Organization, Distinguished Research Expert, External Consultant in Education. Mrs. Alice Garmelia as Member of MTKI, KTKI, STR Validator, and CAR Surveyor. And all of international seminar participants, we want to say, welcome to International Seminar Medical Record and Health Information 2021 by Student Association of Medical Records Setia Malang, with the theme, Building an Integrated Electronic Medical Record According to the Needs of Patient Clinical Care. The schedule for today's event is, first, welcome dance, second, opening prayer by Krishna Bayu Mukti, third, national anthem of Indonesia, fourth, report from the chairman of the committee, fifth, message from the chairperson of the East Java Pormiki branch, sixth, welcome and opening international seminar of medical record and health information by the chairman of STIA. Seven, submission of material is divided into two sessions. First session by first speaker, Mrs. Vicky Bennett. Second speaker, Dr. Sililo R. Amihan. Second session by third speaker, Mr. Johari bin Mohamed. And fourth speaker, Mrs. Alice Garmelia. A closing. Before the event starts, let's start today's event with prayer. And let's hope this webinar runs smoothly. To Krishna Bayu Mukti, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Izinkan saya memimpin doa dengan cara Islam. Hadirin sekalian, mohon berkenan untuk menyesuaikan sesuai dengan keyakinan masing-masing. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Hamdan syakirin, hamdan na'imin, hamdan yuafi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu, kama yambahi li jalali wajahika karimi wa azimi sultani. Ya Allah, ya Tuhan kami, segala puji untukmu, pemelihara alam semesta. Segala puji atas karunia dan kenikmatan yang Engkau limpahkan kepada kami. Segala puji atas keagunganmu, segala puji atas kemuliaanmu dan kekuasaanmu. Ya Allah, ya Tuhan kami, berikanlah kami kelancaran dan kemudahan pada acara hari ini, agar apa yang kami laksanakan hari ini dapat memberikan manfaat bagi kami semua. Amin ya robbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Next, National Anthem of Indonesia, Indonesia Raya. And the next is report from the chairman of the committee. Please welcome Karim Koirisa.
Assalamualaikum warahmatullahi wabarakatuh. Thank you that opportunity but have given to me by the chairman of the committee. Praise to Allah Subhanahu wa Ta'ala. Blessing and greeting to Prophet Muhammad Sallallahu Alaihi Wasallam and the Honorable, the Chairman of the Majapahit Education Foundation, Professor Dr. Tahir Al-Habsi, the Chairman of Setia Malang, Dr. Insinyur Ali Hanafiah, MM, Head of D3 Medical Record and Health Information Study, Mrs. Suhartina, SE, MM, the Chairman Office Java Pramiki Branch, Mrs. Anna Rosarini, AMD, PK, SH, MH. And I will speak at International Medical Record and Health Information Seminar 2021. The Honorable Mrs. Vicky Bennett, as head of Metadata and Classification Unit at the Australian and Institute of Health and Welfare. Dr. Cielio R. Amihan, as leader in professional organization, distinguished research expert, external consultant in education and research. Mr. Johari bin Muhammad, as head of Department Medical Record, Sultania Bahia Hospital, Malaysia. Mrs. Alice Carmelia, as member of MTKI, KTKI, STR, Validator, and CARS Surveyor. Thank you for joining us in today's event. Thank you to all participants from Indonesia, Malaysia, Australia, Filipina, India, Qatar, Sultan of Oman, Jamaica, Sri Lanka, Bahrain, and Japan. I hope this event can going well, profit knowledge to all participants. I think that's all from me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Next is message from Chairperson of East Java Pormiki Branch. Please welcome Mrs. Ana Rosarini, AMD PK SHMH.
Suatu bangunan tidak akan berdiri kokoh dan menjadi bangunan yang indah bila tidak direncanakan dengan matang, tidak dipikirkan dan dikerjakan oleh berbagai spesialis atau ahlinya, atau mungkin tidak ada dana untuk mensupport bangunan tersebut. Dan tentu perlu adanya kerjasama dari semua pihak dalam mewujudkannya. Implementasi elektronik rekam medis dapat dianalogikan dengan membangun suatu rumah atau bangunan yang mulai dari persiapan, mengurus izin, kemudian bagaimana kita mendesain interior, eksterior, sampai dengan mengisi rumah agar nyaman untuk ditinggali. Ini adalah suatu tantangan yang besar bagi kita semua. Elektronik rekam medis juga masih menuai pro kontra dalam pelaksanaannya, disebabkan belum adanya dasar hukum yang khusus. Pertanyaannya, bagaimanakah kita sebagai tenaga kesehatan yang profesional? Apakah ikutan menjadi bagian yang pro kontra tersebut? Apa yang bisa kita lakukan? Sumbangsih apa yang bisa kita berikan? Dan semua pertanyaan itu semoga dapat terjawab dalam seminar kita yang akan kita dengar pada pagi hari ini, sehingga dapat menghapus keraguan di hati kita melalui pemaparan oleh narasumber yang luar biasa dan kompeten di bidangnya. Sebagai akhir kata, terima kasih yang luar biasa kepada keluarga besar Setia Malang. Sukses untuk penyelenggaraan seminar internasional pada pagi hari ini. Juga terima kasih kepada panitia yang mempersiapkan acara dan khususnya kepada narasumber. For speakers, thank you very much for your support. Semoga acara ini bermanfaat bagi kita semua. Saya akhiri sambutan pada pagi hari ini dengan sebuah catatan, khususnya bagi anak-anak atau mahasiswa dari berbagai negara atau mungkin anak-anak perekam medis semuanya. Electronic medical record is a big challenge, but big challenges are internal challenges. Focus on your confidence and giving yourself a chance to grow and shine. Believe in yourself that with this self-confidence you have, you can reach and achieve everything you want. Thank you very much.
Thank you to Ms. Anna for the speech. And the next is welcome and opening International Seminar Medical Record and Health Information 2021. Please welcome Dr. Insinyur Alia Nafiah, MM.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. Alhamdulillah, alamin. The Honorable Head of Majapahit Education Foundation, Professor Dr. Tahir Al-Habsyi, the Honorable Mrs. Vicky Bennett from Australia as a seminar presenter and President of Ismrh, the Honorable of Mrs. Anna Rosarini as the Chairman of Pormiki East Java, the Honorable of Mrs. Nuryati as the Head of Aptir Miki, dear Mr. Silelo R. Amirhan from Philippines, dear Miss Johari Mohammed from Malaysia, dear Mrs. Elis Garmelia from Indonesia, the Honorable Mr. Hadi Wiono as Vice Chairman of the academic field, the Honorable of Mrs. Suartina as the Head of Medical Records and Health Information Program, Setia Malang, the Honorable Mrs. Tri Marhaini as the Deputy Head of Student Affairs, the seminar participants from several countries, Indonesia, Malaysia, Philippines, Oman, Australia, Japan, India, Qatar, Jamaica, Sri Lanka, and Bahrain, which I respect. Welcome everyone. As well as the invited lecturers and practitioners and students of medical records and health information that I cannot mention one by one, and as well as attendees and seminar participation. Alhamdulillah Rabbil Alamin. Thanks God. In the morning we can all gather by virtual connection in a good health and well-being. I say welcome everyone and everybody to Campus Setia Malang in an international seminar with the theme Building an Integrated Electronic Medical Records according to the needs of patient clinical care. This seminar was held as part of Tridharma of the higher education and was a place to share knowledge and information in the field of medical records and health information as a place for creativity from student association, from medical records and health information. As we know, in the current pandemic period, most of us have just realized that health and healthy living is very important. At this time, all aspects of life in the world are forced to adapt to the atmosphere of a pandemic that is still not over until now. There are some aspects are not able to survive, and some are still surviving, and some are getting bigger. Almost all of physical activities are reduced and transferred to non-physical or virtual ones. The education sector is also not immune from the impact of this pandemic, so that the teaching and learning process also uses virtual. We are all humans, as social beings, are certainly disturbed by circumstances like this, but we must not give up on the situation and need to innovate so that life can continue to run well. Therefore, the teaching and learning process, one of which is learning through seminars, must continue, so that in today we can attend together to attend a medical record seminar with the theme of building an integrated electronic medical records according to the needs of patients' clinical care, which will be filled by competent speakers in the field of medical records and health information. I would like to thank you for all the presenters and participants who have taken the time to participate in this event till the end. I hope the knowledge gained will be useful. Finally, by saying Bismillahirrahmanirrahim, I open this international seminar. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Ali for the speech. Before the event starts, all attendants are requested to activate the camera for the documentation session, especially Mrs. Vicky Bennett, Dr. Sililo, Mr. Johari, Mrs. Elis Garmelia, Chairperson of Setia Malang, Chairperson of the East Java Pormigi branch. Alright, sesi documentation akan dimulai. Documentation session will start. Documentation session will start. Thank you for all participants. All right, the moderator of international seminar is Mrs. Soraya SSMLE. The resume of the moderator today are worked as supervisor in Kizania, Jakarta in 2007 until 2008. Worked a teacher in Sekolah Pintar Kak Seto, Yogyakarta in 2008 until 2009. Worked secretary at Ars Longa Gallery, Yogyakarta in 2009 until 2010. Worked a lecturer in Setia Malang in 2010 until now. Studied English Literature of Brawijaya University, Magister in Linguistics of Brawijaya University. All right, to Ms. Soraya, time is yours.
Thank you, Eva. Good morning, everyone. Hi. Today, I will be your moderator seminar. I'm very pleased that you can join this international seminar. And today, we will have 4 speakers. The first speaker is Mrs. Vicky Bene, the president-elect of Ismrh. Will talk about the role of electronic medical record in the preparation of health information management in accordance with the current law. The second speaker is Dr. Amihan, LPT, MID, MSP, PhD, leader in professional organization, distinguished research expert. Will talk about psychological influence with the application of electronic of medical record in healthcare professional. The third speaker is Mr. Johari bin Mohammed from Malaysia Sultanah Bahia Hospital. Will talk about implementation of electronic medical record in patient clinical nursing care. And the last speaker is Mrs. Alice Carmelia, the lecturer from Polytechnic Semarang. We will talk about competence of medical recorders and health information in the face of electronic medical record preparation. Today, we will have 2 panel discussion. The first speakers of first session are Mrs. Vicky Bene, the president-elect of International Federation of Health Information Management Association of or Ismrh. You can see the resume on your screen. And the second is Dr. R. Amihan, from Philippines. We also have great resume. La Sallian graduate, curriculum specialist, leader in professional organization, distinguished research expert, external consultant in education and research, internationally awarded in educational leadership, lifelong learner, and industry collaborator and socio-cultural advocate. We'll talk about psychological influence with application of electronic of medical records on healthcare professionals. We can see on your screen the resume of Mrs. Vicky Bene from Australia. For the second speaker, Dr. Amihan, he also have a great resume. It's very impressive. Dr. Amihan ini keren banget. Bisa dilihat resumenya on your screen. Please. Okay, before the first session begin, I will all of the speakers who will not present, and for the participants, please mute your speaker during the presentation. And you can ask your question by raising your hand, or you can writing in column chat. Each of the speaker will give time 30 minutes for the presentation. After that, we will have the first panel discussion for 30 minutes. Oke, sebelum dimulai peraturannya, selama para pembicara presentasi, tolong partisipan peserta dari seminar internasional ini dimatikan ya speakernya. Jadi suaranya akan jelas untuk para speaker. Oke, sekarang please welcome Mrs. Vicky Bene.
Thank you everyone. I will just try and share my screen now. Are you able to see my screen? That looks like it's working.
Yes.
Right back to the beginning. Thank you for inviting me to speak with you today. Very distinguished colleagues that I am speaking among. So, I send my respects to you all from the many countries that are participating here today. As announced in introducing me, I am currently the President-elect for the International Federation of Health Information Management Associations, which is a great privilege for me, and I am also on the board of the Australian Health Information Management Association, having been president here previously as well. But as you see, I work for the Australian government at the Australian Institute of Health and Welfare, which is our national health data agency in Australia, and I run the team that looks after metadata and classifications work. And my team is also part of the WHO Collaborating Centre for the Family of International Classifications, the ones who do the ICD 10 and 11 development work. So hopefully with that experience, I'm able to talk to you a little bit about the role of electronic medical records and the role of health information managers in ensuring that we do that so that we do deliver good patient care. There is really no set global definition for what an EMR or EHR, and I'll use those terms interchangeably because electronic health records and electronic medical records are often described in the same way. Although some people try and distinguish between them, but this is one area that people have tried to come up with a definition, and so that they say electronic health records is a longitudinal electronic record of patient health information generated by one or more encounters with any healthcare setting. Or an EHR typically captures patient demographics, progress notes, medications, vital signs, past medical history, information about any conditions or diseases, immunisation status, which in the current world is very, very important, records of hospitalisations, treatment plans, laboratory data, radiology reports, to name a few. It also has the ability to generate a complete real-time record of the encounter, but as well as supporting the coordination of care activities between healthcare settings and making sure that we get good quality outcomes for patients. Now, having EMRs or EHRs is something that we are striving for, but there are many challenges for countries at both a local level and a national level to try and implement these. Certainly, I have done a lot of work in low and middle income countries over the years, and simple things such as having a consistent supply of power or having good internet bandwidth can be severely limiting in our ability to implement these. But there are other things like the skill of the workforce to manage the ICT systems that are required, or making sure that that system can be running 24 hours a day, 7 days a week. Probably, though, the largest issue I have found in every country, and we'll talk about this a little bit more, is sustained funding. Often donors are quite interested in helping countries establish an EMR or an EHR system, but it is up to then countries to be able to continue to fund that. Not only just the software licenses that are the problem, but the hardware that's required to be upgraded over time. So very significant challenges there. Even in high-income countries such as Australia, where I come from, there are huge challenges, and I will talk to some of the data about the Australian EMR uptake shortly, but people in our country are worried about things like the risk to the privacy of their health information. We also have lots of existing data systems and record collection environments. And so being able to bring them together is a significant challenge. The lack of unique health identifiers across the country and interoperability standards so systems can talk to each other, they are also very significant challenges. And again, I raised the issue about funding that can be both in the private sector and the public sector. But my biggest point there is that if we, at the bottom in the orange, is the need to have clinician buy-in in the design and use of the system. Because without that, clinicians won't put the data in the system. The system can be as good as it needs, as it can be, but without clinician buy-in to the changes that we make, we really don't achieve a good outcome. But there are some enabling factors that I think that help ensure that we get good EMR, EHR uptake in countries. And having a clear national strategy is certainly one that I think helps. Depending on how your health systems operate, a national strategy may not be as important, but I still think if we want to be able to have systems that talk to each other from one site to another, that is going to become very important. Mentioned before, the unique health identifiers also are very important. Unless we can know that we are definitely talking about the same person across multiple settings, we can actually harm patients by sharing information about wrong patients. So that's a very important element. There's a whole body of work that we do need to know and do and have done around governance, policies and procedures. I suspect in your country, like as mine, wherever you're from, doctors are already just starting to grab their phone and take a photo of an injury or a wound and share it with colleagues. But how do we govern the information that's captured in those things? What do we have around policies for bringing your own device and how those digital images are then part of the patient's record? And we must be able to have systems around access control and audits to make sure that only those people who should be accessing patient information are getting access to that. As I mentioned, my team where I works on health data standards and metadata. It's a bit like having a unique identifier, but we need to know as we share information from one system to another that we are talking about the same thing. So I often talk about it being able to count apples and apples so that we know that we're talking about the same thing. We can't put a piece of data from one system to another if we don't have a shared meaning. So things like clinical terminology and interoperability standards are important. Again, legislation to ensure our patients are confident that their privacy is protected, and that we are able to use those records for things like evidence in court. So things like electronic signatures are allowed. Lots of important review of our national governance arrangements in those settings is required. And sustained financing, I'll say it again, financing is still a very significant issue in every context. And my point, I guess, at the bottom there is that we must apply both these enabling factors to both the public and the private sectors if we really are going to have good national integration. So some guiding principles, I think, that are worth sort of outlining, and this is some of the work I've been trying to do with some of WHO colleagues in the region, that if at country levels we can have these principles guiding sort of the plans for EMR, EHR uptake, it would be really important. There must be local ownership and good stakeholder involvement. We must ensure that health consumers are the focus of how we plan to implement them, so that they are the primary focus of why we would do this. Where possible, we should be trying to adhere to international standards as well as our national standards, and making sure that we have good universal coverage, equity, quality, and social justice, which is obviously part of the SDG agenda for good subnational inequality in the way we roll these things out. There are opportunities to collaborate and partner with those that are already doing work in this area, so we don't have to reinvent the wheel, and we can learn from the experience of others. So that is also a good principle. We need to be careful and efficient in the way we use resources and be accountable and transparent if that is public funding. We need to make sure that the systems we implement have good privacy protecting safeguards, and where possible, keep the technology simple. Because of the cost of it, sometimes a simple solution is often the best rather than the most complex. And as again, equity and inclusiveness of all parts of society is important. I guess one of the challenges I feel is that, and many times the digital technology becomes the focus of the work rather than the content of the collection that go into our system. So we've got to be very careful that as those working to help implement EMRs within our countries, that we actually have the primary purpose of keeping the patient information available for the use for the patient, the right patient at the right time in a usable way, as the main focus rather than the technology itself. We need to make sure that information is able to support the diagnosis and treatment of that patient, and that information helps us understand the quality of the care provided. The secondary purposes, though, which are still important, are that the information captured in EMRs can improve the information we can require for research, data quality reporting, and to understand the value of the system that the services we are providing. So having the patient at the centre, though, is still the primary purpose. even though we know the technologies are useful and can improve patient care, we then also have to think about how we will implement those systems. We can, as I said, have a great system, but who will enter the data? How do we help our workforce adapt to being able to capture some of this information electronically? How will that impact the clinical workflows? How do we make sure that nobody's left behind and that some aspects of our health facilities are not missing out? Making sure that the quality of the information that we capture, but if the information isn't good quality, could actually harm patients through poor records. Making sure we have, as I said, the privacy and security and information governance requirements, and being clear about the value proposition. What is the benefit for why we would want to go down this path? So those are also clearly very important. I'm just going to take a moment to talk about data quality, because I think it is an area that is yet to be well understood in the use of EMRs and EHRs. There are lots of issues in every setting, regardless if it's a low and middle income country or high income countries, where data that's captured is not complete, it is inconsistent, inaccurate, there's no processes for validation, and maybe not timely. Here are some quick examples of the sorts of clinical scenarios where we find issues with data quality and the impact, which can have a clinical impact on the patient. It may have cost impacts for the system. If contact details, for example, aren't accurate, patients may miss out on being reminded for appointments, so the system and services are running ineffectively or inefficiently. So I think there are a lot of issues to be dealt with in data quality across all systems. So one way to do that is to improve systems. We need to adopt things like clinical terminologies, unique identifier and data standards. And if we have unique identifiers for the individuals, providers and organisations, we ensure that we have the right information associated with the right patient at the right time. Now, I had the very delightful privilege of visiting Indonesia very briefly in 2008 to attend an Ismrh Congress, which is, if you know, before it had a name change. And we grew up to be HIMs and not just records managers. And our Congress for the Southeast Asian region was held in Bali in 2008. And I got to visit 2 of your facilities as site tours there, and met many wonderful colleagues on that trip. And I note when I found all my old photos, as below on the screen, there was a lot of paper, there was a bit of computerization. I'm hoping that 13 years on, I would see maybe less paper and more computerization. And I look forward to perhaps when the world is less crazy with global pandemics, potentially to revisit Indonesia and to see the progress that you have made in that time. But it was wonderful, and thank you to Elise, who's on the call today, for your invitation today and for our strong friendships since that very time.
This is the Sangla Hospital, I think. PK.
Yeah?
Sangla Hospital in Bali.
Yeah.
Yeah.
That's right. So we had a site tour for the international delegates, which was wonderful.
Yeah.
Oh, too far. Okay. So in Australia, I'll give you just a bit of an update, because you may think we are further ahead in Australia than we are. In fact, we only have around 65% of Australian hospitals who have EMRs implemented at this stage. So, you know, that is only about 2/3. So there are many facilities here in Australia, and that is just our publicly funded hospitals. The numbers in our private facilities are far lower. I didn't have statistics on that, but so don't be despondent if the countries that you are from are not having EMRs everywhere. It certainly isn't the case in Australia, due to many of the challenges that I already mentioned before. As I said, the cost of software licenses and fees is a significant challenge for all countries. Implementation approaches are often top-down, so clinician involvement in the design of those systems isn't as good as it should be. Maybe the clinicians don't feel that EMR fits into their basic clinical workflow, and the lack of integration with other systems still being a significant challenge. So in Australia, though, we do have, one of the things that I said was having a good national strategy. We have a thing called the Australian National Digital Health Strategy, which has a roadmap for delivery. And one of the key elements you'll see highlighted there, number one, is the My Health Record, which is a national collection of documents from across the health system about an individual patient. And it's designed to make sure that the health information is available whenever and wherever it was needed to treat the patient. It has some key benefits listed here, and these are things designed to avoid adverse drug reactions, improve the systems through secondary use of the data, so being able to analyse data, enhance patient self-management, because patients are able to upload their own documents there, to improve patient outcomes, to reduce time gathering information, and to potentially avoid duplication of diagnostic services. So you'll see here on the screen that a significant different types of healthcare providers and healthcare service settings are able to load documents into the My Health Record. And they include things like discharge summaries, event summaries, diagnostic and pathology, prescriptions, referrals, so that all of the information is stored in one location that all clinicians are able to access at the point of care once they register for use of the system. I want to focus now on health information managers, and for those of you who are on this conference who are health information managers, what you can do to make sure that health information managers are part of the implementation of your EMR systems. You have to believe and promote the fact that HIMs are experts in health information governance and have the skills and knowledge to be able to assist in that role. You also have the skills to help understand or apply that, the governance and the legislations that apply in your country within the context that you are working. You also have to make sure that we balance the need for access to information with the rights of the patients to the privacy of their information. When we had paper records, we could lock the door at night to our medical record storage rooms. Now we have to be involved in making sure that the privacy and security of the information that's captured electronically is also managed properly. And just remember, HIMs have been managing patient records for decades. And just because there is a new platform that is maybe electronic rather than paper, we know how best to govern that, and we need to be part of that team that does that. There are also, for those of you who may be interested, some learning modules available on the IFHIMA website, and I've left you a link there to that. And the first of those is a learning module that is entitled The Health Record from Paper to Electronic. And I encourage those of you who might want to have a good, simple overview of that to have a look at that learning module. That is free on the website for anybody to access, and has been designed for those who are trying to move from paper to electronic environments. I again encourage you to be involved health information managers have unique skills for working in electronic health records, both in the past, as we always have, and into the future. So when your facility or your government or wherever you are working is considering implementing an EMR or upgrading or being involved in modifications, enhancements, make sure you put your hand up to be involved. Don't stay in your paper basement departments. Put your hand up and say, yes, I can be involved. I'm very knowledgeable in this space. I can help make sure that we do it the right way. The other thing I encourage you to do is learn about new technology that is emerging. Learn about new things like interoperability standards. FHIR is the new health interoperability standard of interest. Get online and do some online learning. Much of it is free and openly available. So please make every effort to stay abreast of new and emerging things that are happening in health information and informatics standards at the moment. Engage in data analytics that are possible from your EMR data. You collect much information across many systems, much of it that is poorly used after the fact. Yes, the primary purpose is for understanding how to make sure we treat patients properly, but there is a lot of data available that we often don't analyse to produce very important learnings from how our health systems are running. So that is another really strong area of growth in data analytics from our EMR content. And I guess I leave you with saying yes. I was working in a hospital, implementing a new patient administration system, working very long hours. I had 4 small children, and my CEO came to me and said, oh, you wouldn't want to go and do a project in Vanuatu, would you? That would be hard, wouldn't it, with 4 children and a husband? And I said yes. And since saying yes that day, I have had a fantastic opportunity to work with WHO and other global partners in many low and middle income countries across the last nearly 20 years, because I took the opportunity to say yes. So let me encourage you, when new opportunities come, not to be afraid of the change, but to go with the change and be part of helping deliver the change in a way that is best practice for health information management. And with that, I would say thank you very much for inviting me to speak today. I look forward to hearing the other presenters as they speak also. Thank you very much.
Okay, yes, thank you, Mrs. Vicky Bene, for a great presentation. Wow, it was very wow. Okay, so according to Mrs. Vicky Bene, primary purpose, the use of digital technology in healthcare, information primarily about patient in a way that is correct and up to date, accessible, the right people at the right time, in usable format. And for the quality of good data, consists of 5 criteria. The first, completeness, consistency, accuracy, validity, and timeliness. Jadi, menurut presentasi Mrs. Vicky yang keren banget itu, tujuan utama penggunaan teknologi digital dalam perawatan kesehatan itu adalah semuanya tentang pasien dengan menggunakan cara yang benar, informasinya up to date dan dapat diakses oleh orang yang tepat dan waktu yang tepat. Kualifikasi datanya itu biar bagus atau bagus ya, kualifikasi datanya itu harus memenuhi 5 kriteria. Yang pertama adalah kelengkapan, konsisten, akurasi, valid, dan ketepatan waktu. Okay, thank you for the great presentation, Mrs. Vicky Bene. And now for Dr. Amihan. Dr. Amihan, time is yours.
Okay. Hello. Please allow me to share my screen. Okay. So good morning once again to everyone. Thank you
Good
for
morning, Doctor.
inviting me to be part of today's international seminar of medical records and health information. And it's also a bit relieving to hear the words of Miss Vicky. I think I won't have to push the panic button yet. It's because with the realization that it's still not too late really to go full towards EMR systems and health information management, especially in the context of the Philippines. I'll be talking about the psychological influence in the application of EMR on the healthcare professionals, recognizing that when you implement the EMR systems as part of the health information systems, there is a human element involved in it. But allow me first to make a connection between EMR, telemedicine, and providing you a context, especially in the Philippine setting. Now, we understand that for telemedicine to really be fully effective and to be fully implemented, we really need to have established EMR systems in place. And it's a timely response then in 2019. It was cited by Montemayor, especially in the Philippines, uh, timely in a sense that we had just signed our universal healthcare law in the Philippines, and that would really require our health service systems to be interconnected with each other so that we could really reach out as many as possible for the patients. However, it's now really more timely than ever. It's because of the pandemic, and the pandemic somehow offsets, EMR and telemedicine somehow offsets the restrictions caused by the pandemic. So we are now reflecting on digital transformation for the universal healthcare. At the same time, as noted, it would somehow provide and allow for real-time detection of mistakes. So it would somehow mitigate the risks, of course. But it's not an easy thing to implement, especially when you talk of the macro level. There would be different barriers in telemedicine. And although if you could note in here, there are different categories of barriers, and those categories would mainly be on the non-human elements such as technological factors and others, but there are human elements involved also. So I would pounce on that human element, focusing on the psychological aspects or the influences of the EMR. For the technological factors, of course, it's pretty obvious already that there is a technological divide, and the disparity is getting greater. But we really need to catch up. And especially here in the Philippines, we still are hoping for better network coverage. And it would be very difficult really to merge and have an interconnected, unified system if there would be different diverse information systems that won't have uh, won't be able to be compatible working together with the other systems. And there would also be organizational factors. Now, the organizational factors would include the design of the medical care model, and there would be different designs being used by the different healthcare facilities. And the lack of enabling policies and guidelines, especially in our context. We have just, the EMR and the healthcare information is not really that mature yet, although as noted, in 2019, I think 2019, we had already 180,000 full-time employees involved in the healthcare information management systems. And it's expected that there would be a leap, especially with the pandemic around. For the human factors, of course, it's relatively new. for those who are already working and who are really acquainted to the traditional way of handling the information, then there would be a lack of skilled health workers to be able to implement the EMR systems. And of course, it's part really of human nature for us to resist to the change. And a lot of my discussions later on the psychological influence would really be anchored on that resistance to change. And the aim really is for us on how to allow the acceptance of EMR systems for the healthcare workers. And there would be perceived additional workload, of course, and the lack of reimbursement schemes and others. And there is also lack of liability. And those are things that would really somehow hamper the effective implementation of EMR systems. And part also are the economic factors, talking about additional costs for funding of setting up those systems and making it sustainable so that it would be useful in the long run. Now, pouncing on the psychological effects or issues, the first would be on the personological variations reflecting on inclusive care. Now, the image you could see in there is a rainbow that's somehow reflecting different identities of individuals. With the healthcare information systems, there would be information that needs to be inputted with data. And part of that data would be data reflecting the identity of both the patients and the healthcare professionals. And part also of that data would be a question about their gender. Okay? And a question of gender is somehow a bit a cultural thing also, and there would really be some hesitation and reluctance from other users with regards to revealing those kinds of information. So it's a matter of personality also, and that would somehow be a reflection of individual identities of both the health professionals and the users and the patients, of course. And the different views of the nurses on patient safety culture would somehow influence also how they view the EMR systems as a whole. And when you talk about personological variations, it has something to do with customization. Of course, the end users would want to operate on systems that are really customized to their preference and to their own beliefs and biases, perhaps. However, there may be certain limitations with regards to that. It's because the organization should have a certain degree of customization on the organizational level. However, there would also be customization coming from the providers. So there should be a meeting in between. But what's being pointed out in here is that there are certain preferences that would be tied down to individual users with regards to their identity. Another is internal locus of control. Okay, not all individuals would have strong internal locus of control. Some would really believe that there is high external locus of control because of the implementation of the EMR. Okay, maybe they would perceive, the healthcare professionals would perceive that because of the EMR systems, somehow the control is not on them. It's being diffused already, or in the decision making and other aspects would be incorporated already in the EMR systems. However, there should be a sense of internal control coming from the healthcare professionals. It's very important for the individual. And you could actually attain that. Healthcare professionals could actually attain that when there would be feedback coming from their services. It would somehow create a less stressful environment. And because of that, they would gain a sense of control over what they are doing, and therefore a higher level of internal locus of control. Another key concern, of course, is safety and security, and it's part of our basic needs. Uh, using the Maslow's hierarchy of needs. Safety needs are part of our needs as human beings. And we really need to satisfy these needs, particularly on the EMR systems. There should be an assurance of a safe teleconsultation, and when there would be more attempts, there would be more ways or additional loads so that the healthcare professionals would be able to preserve and ensure safety, then it may also add stress. It's because it's an additional workload. However, there should be systems in place to ensure the safety and security of the information, especially those identity revealing information on the part of the healthcare professional. And because of that, there have been biometric authentication technologies being widely used in the health information systems, and including also the encryption for confidentiality of information. Now, these technological innovations are aimed really to provide safety and security for the healthcare professionals in the implementation of the EMR. It's also very important that the healthcare professionals would be mentally ready to implement the system. And when you talk of mental readiness, it's really mainly based on cognitive readiness. They should have that belief also that they are capable and able to perform such duties. It's because they have the knowledge for it. But try to reflect also on the loss of readiness by Thorndike, wherein there would be three loss of readiness. First is loss of learning. The first is on the law of mindset or readiness. Another is in the law of exercise, and then the law of effect. The law of readiness will somehow ensure that everything is in place, not just on the technological aspect, but also on the psychological and cognitive readiness of the implementers of the EMR systems. Another is the law of exercise. They must have the enough training and experience so that they would be able to successfully implement the EMR systems. Another is, of course, we really need to have it integrated in our training, even for the pre-service healthcare professionals. So it should be integrated in the curriculum, and there should be um, close coordination between the academe and the industry with regards to the on-the-job training experience. With all those things being implemented, then there would somehow be mental readiness already by the healthcare professionals to be able to successfully implement the EMR. Another is self-efficacy. Of course, not everyone is well oriented and really trained to be able to facilitate the EMR systems. So when there would be additional unfamiliar, somehow alien workloads such as the EMR, especially for those who are already working in the healthcare systems for longer periods of time, then it would be perceived as they would somehow have a low efficacy because they would perceive of it as a new, unfamiliar workload which they have no prior experience to handle. And somehow, to gain high self-efficacy, when there would be an increased perception on the value of the its use, there would be higher success rate also in its implementation. So it's very highly important that the healthcare professionals would have that feeling of them or of confidence in their own capability to be able to implement the EMR systems. Next, of course, is burnout. With the implementation of EMR, pretty much we are trying to rely heavily on technology. Computer screen fatigue is very, very common. It's known as asthenopia. And it's not just on the students right now because of the online distance learning modalities, but because of the EMR systems, we are now, the healthcare professionals are more exposed to the computer screen more than ever. And somehow, in a study, physicians would spend half a day in front of the computer monitors. Half a day. Okay. And for student trainees, it's projected that they spend on average 4.42 hours a day just for the training for the health information management systems. So, given those scenarios, there would really be expected burnout. It's because we are just human beings and we get tired, of course. And adding to that, really, is on the multifunctions of the healthcare professionals because of the EMR systems. The computers, the technological side of it may be able to absorb the immense information, okay, because of the interconnected integrated information. However, as human beings, we could not really absorb everything, okay, and because of that we may be overwhelmed with the immense data that's in front of us, and that would cause somehow burnout. But on the other hand, because of the EMR, there would also be mental focus. Okay? Mental focus is because it's really very appealing and pleasing and very relaxing to work in an environment that is clutter free. When you try to compare a traditional setup in trying to manage information, comparing it with the present setup of having an established DMR system, it would really be a clutter free environment. And because of that, it would somehow provide a mental focus because they would now have an improved focus and attention to which information they should prioritize and focus on only. Another is emotional effects. Okay, there should be a connection between the emotion and the brain or the cognitive aspect. When we try to convince the healthcare professional to be able to use and implement the EMR as part of their workload, it's not just trying to convince the rational mind. We should also try to convince their emotions. It's because they are interconnected. So there should be a marriage between the heart and the mind or the brain. Okay? It's because whatever we perceive cognitively would also have its effects on how we value and how we and the attitudes that we have for a particular system, and in this case the EMR systems. And I would want to think that because of the EMR, we now have an additional defense mechanism. Somehow the EMR would represent the shields that being healthcare professionals, we are really exposed with a lot of stress, a lot of negative vibes in a sense. And with the EMR, we have now a bit of a shield from the anxiety to both, well, coming from the stress because of the nature of work that we have. And aside from that, we now are able to channel our emotions with lesser threats. Although in general, defense mechanisms are not really highly encouraged as a long-term strategy, but this may provide useful at the given moment so that we would be able to adapt and live normal lives. But on that moment, on those moments wherein we would be exposed to threats of anxiety, EMR, because of the less interaction, physical interaction with the patients, then we would now have a caution. We won't be able really to be penetrated with regards to the negative effects of those interactions. And highlighting also that EMR may serve as a psychological buffer for us, connected also with the defense mechanisms. Although not in all cases that there would be loss of life and other traumatic experiences, but the Kubler-Ross grief cycle would also be applicable even in breaking the negative or bad news to our clients. And it's really putting us on a different or in a difficult situation on how really to break the bad news. Now, because of the EMR, we now have a cushion since we are shock absorbers in a sense, but now there would be a wall in a sense, so that it would absorb whatever those negative vibes and anxiety leading stressors would be causing on us as mental health professionals because of the EMR. So it's really a good thing. And we also would have a bit of immunity from the transference, noting always that there would be limited face-to-face interaction. And because of that, it would be very difficult for the patients connected with the healthcare professionals to have established transference and counter transference. And of course, there may be some positive effects of transference, but we would be shielded from the negative effects of transference that would somehow influence our judgment and our interrelationships with our clients. And allow me to highlight that even in the health playbook, when we try to conduct telemedicine, it's not just a matter of being very careful with the content, careful with the technological aspects and others, but it's really a matter of preserving psychosocial interactions. When you try to look into the details in here and you try to convey value with your welcome, trying to introduce technology for first-time users, collaboratively set the agenda, and even expressing empathy and doing reflective listening and providing closure. It's not just to settle or to set up a mechanized EMR communication. It's really considering the human element in interacting with our clients. So there would be psychosocial interactions involved also in our practice, even if we are utilizing technology through EMR. And it is really expected that there would be reluctance to introduction of technology, and in this case, the introduction of EMR. Regardless, perhaps, on which aspect they are trying to resist on, whether because of they don't want to have wheels, they don't want to have new technology or anything, as long as they could say no. It's really part of human nature that the individuals try to resist. So it should not be much of a big factor, a deterrent, if you would be introducing EMR systems in the healthcare facilities and you would be welcomed with resistance, with varying degrees of resistance. It's because it's something normal as a reaction for human beings. But what's important is that you would be able to convince them to embrace that change and that acceptance. And the best way really for us, so that the healthcare workers and the patients and of course the organization as a whole would be able to embrace the change, is not just on the organizational level, not just on the technological level and the other aspects, but we really need to focus on the psychological element of the acceptance. And because of that, organizations should really highlight on how to win the implementers of the EMR, mainly the healthcare professionals, how to win their hearts so that acceptance now would become part of their priority outcome in trying to push for planning for change, integrating EMR in their ways of delivering their services. These are some of the references. So thank you and good morning to everyone.
Thank you, Dr. Amihan, for the great presentation. Wow, that's very interesting material. Okay, so according to Dr. Amihan, changing is continuously, whether we're ready or not. The changing around us is affecting our psychology. Our mental needs, there are 5 mental readiness. There are self-efficacy, learning behavior, burnout, mental focus, emotional effects, defense mechanism. Some people are resistant to change to EMR, or is we who decided whether we accept the change or not. Terima kasih Dr. Amihan untuk presentasi yang sangat menarik. Jadi menurut Dr. Amihan, perubahan di sekitar kita itu akan selalu ada. Tinggal bagaimana kita mau menerimanya. Kita bagian dari perubahan itu atau kita bagian yang tidak menerima dan ketinggalan. Okay, thank you. Now it's come to the first panel discussion. First panel discussion for 30 minutes. I like to have 3 questions from the participant. Okay, we already have the question from Medan. Hello, Mrs. Vicky. I'm Giatno in Medan. I want to ask you, is there a legal basis in Australia for application of electronic medical records, especially for the doctor signature? Thank you.
Thank you very much. Yes, there has been a lot of work done to modify national legislation to allow clinicians to sign documents electronically. Some of that is state-based legislation. We have different levels of government, so some of it is a local legislation, some of it's national. But that's one of the enabling factors that I mentioned, is that it's very important that we have our Evidence Act, so things that where we get a medico-legal inquiry because somebody wants to take an action in front of a court. There must be legislation that allows for electronic documents to be seen the same as paper-based records, and also electronic signatures. However, the challenge with electronic signatures isn't just a legislative issue, it is about being able to uniquely identify each individual clinician. So making sure that each clinician that signs on to use your system isn't sharing a login with someone else and a password. So it must be really important to have separate logins for every clinical person who's going to put content into your EMR, because otherwise we can't know who signed that document. So legislation is one thing, but how you manage your systems at a local level by making sure that you don't just have one login called ED doctor that everybody uses. You've got to have one for every separate person in the system to maintain that same level of robustness around being able to uniquely identify who signed that particular order or entry.
Okay, yes. Thank you, Mrs. Vicky. Giatno in Medan, I hope that answered your question. Okay, next we have from Malaysia. I'm Oni Saifura from Perak. Hello, Mrs. Vicky. I want to ask you about how medico-legal cases been managed or handled with EMR in Australia. Thank you.
Thank you. It is done quite differently depending on the facility. Most health information services, so the department that would normally manage your paper records, now manage the electronic records as well. and requests, medico-legal requests, still usually come to the Health Information Service for action. One of the things that is really important to do is to make sure all of your clinicians know that they are not allowed to provide information to a patient or a relative or an output from the system. I worked in a hospital where a nurse printed out a whole psychiatric history of a patient because the patient asked them from an EMR and handed it to them without redacting it, without doing all the appropriate things that health information managers would know how to do. You know, that nurse was probably just didn't understand, but that's actually part of, I think, our role as health information managers is to make sure the workforce understands that there are strong privacy and security protections that applied previously in paper still apply in the electronic. Just because they can print something out doesn't mean they're allowed to. So it's more about processes that you must implement at a local level. And again, education, education, education.
Okay, thank you. Now we have from Marcelius, please. Ask your question. Mas, di mana ya? Ada yang mau nanya nih. Yang ketiga. Merto. For Mrs. Vicky. Yes, please. No, nggak ada ini. Mana ini yang mau tanya? Oke. Ini Wiwit. Mana ya Wiwit ini? Tadi mau tanya? Silakan Mas. Mas atau Mbak ini ya? Silakan, jangan malu-malu.
Sepertinya ada di chat room, Miss Soraya.
Ya, Bu Els.
Sepertinya ada di chat room yang bertanya. Mungkin bisa dibacakan langsung di chat room.
Mana? Oke.
Ada 31 ya.
Ini. Mana? Sebentar, itu tadi sudah saya bacakan Bu Els, beda Bu Els. For Mrs. Vicky, how do I start implementing EMR here? I see a senior doctor, an old medical workers who do not understand technology, and it's so difficult to change a habit. From Cynthia Fitriani.
Thank you. Yes, that is a challenge everywhere. I don't think anyone has solved the problem completely because I can see my colleague from the Philippines smiling also because I'm sure that this is the case in every single country. One of the challenges we have is the legacy of our more senior clinicians not being as technologically capable. And certain areas of hospitals in particular are less likely to come on board. I would say obstetrics is one of the places that I found that most hospitals find it very difficult to get technology into. Other places where the clinicians themselves are using a lot of technology in their medical practice and surgical practice, things like ophthalmology with laser treatment. People, those clinicians are usually more technology focused. So you'll often find that you need to get what we often call a clinician champions to help bring their colleagues along. I think that's what I mentioned a lot in my presentation is about if you don't have clinicians involved in designing systems, because they're the ones who will have to use it in a daily basis, putting their own records in there instead of writing on a piece of paper. They have to type in the system or use voice-activated recording or whatever the system is that you put in. That's why I think it's incredibly important to have clinicians involved in designing and implementing. It never works if we don't. And I guess that sort of talks to the point of change management. Change management is still the hardest part of any EMR implementation process. And my colleague from the Philippines talked a lot about the psychological aspects of putting an EMR in place. And I think if we fail to consider those things and how we implement and the process for implementation, we set ourselves up to fail regardless of how good the technology is.
Okay. Yes, thank you, Mrs. Vicky. Now we have last question for Mrs. Vicky. I'm Norlinda from Malaysia. Since the usage of Ismrh is more extensive in Australia, do you mind sharing during the initial stage, was there any resistance towards the EMR usage, especially among the senior clinicals?
Absolutely, definitely. I guess there's two ways to approach EMR implementation. One is the big bang approach where you go straight from all paper to all electronic. Many facilities have taken a mixed approach where they may have some of their content captured electronically. Maybe it's going to be pathology, radiology, pharmacy, certain areas, maybe mental health or theatre reporting, and then still have some paper records, which then they would look towards moving to scanning, so they are available electronically. So there's sort of two pathways that facilities choose. Most facilities end up with some computerization before they go to a full EMR environment. But that needs to be considered about the facility you're working in, what kind of funding you have, the clinician buy-in. As I say, if I was running an eye hospital, I would probably have no problem putting in an EMR. But running an obstetrics hospital might be much harder because those clinicians are less technology savvy as a whole in their professional practice. So, it's very important to understand the people you're working with, the way your hospital works, the funding you have. There's no point promising the clinicians the world and delivering them very much less. So managing expectations also is very important.
Vicky. Now we have question for Dr. Amihan. It's from Megatri Wulansari Stikes UDH Tangerang. Dr. Amihan, how to overcome the barriers telemedicine that we know until now found at all around us? Thank you.
Okay, hello. Good morning once again. Well, if there would just be a simple formula for us to be able really to overcome the barriers that
I'm sorry, Doctor. Could you louder, please?
Hello. Hello, is it okay right now?
Okay. Yes. Okay. Thank you.
Okay. Sorry for that. Well, if only we already have developed a formula and have it be inside a pill, and we could just simply take that pill so that all the barriers would be gone forever, then it's okay. And then therefore we already have a sure solution to things. But it's really something which is expected. And it's the first step would really be to recognize that it's something normal and it's something expected. Although I would want to connect with the statements earlier said by Miss Vicky, uh, I still am confident that we could still teach all dog new tricks in the healthcare industry, although it would be more challenging compared to having it be embraced by the young ones for because they are digital natives. But there is still hope. I think they could still evolve and come up with better versions of themselves. And we won't want really to have healthcare professionals that would become obsolete later on. And if we fail really to adapt to technology, it's not just because it's the trend, but because it's the need right now, especially with the pandemic going on, then I think it's really important for them to be able to adjust and embrace that technology. And it's something that can be learned. Okay, so the old ways can also be unlearned also, but it really is a challenge. But connecting with those barriers, the first really would be to recognize that the barriers are there, and it's not a smooth sailing implementation, not at all. I don't think we could have an experience of one nation wherein they encountered no problems with regards to that. But it's really a matter of trying to overcome the barriers. And I think with what was presented earlier, I think the clue there really is on how we try to approach and how we try to sell the idea also of establishing the EMR for those implementers. Normally, the resistance, the psychological, the personological factors would be because they would feel that it's more of a burden for them rather than a something valuable and that would benefit them. So it's a matter also of trying to convince them, trying to do the convincing through reasoning. Okay? But of course, as human beings, we are not just influenced by our minds. We are also influenced by other aspects. And because of that, they would somehow resist in general. They would resist the change if the change would be viewed as something external and being imposed on them. Okay? It is very important now that at the start, at the initiation, at the planning stage, for you to be able to integrate the EMR to your operations in the healthcare systems, the people involved, the implementer, should be involved also in the planning. It's because all the policies, all the procedures, they become part of it. They understand the risks and they also understand the values. And if it would be implemented, of course, it would be highly unusual that they would be complaining and resisting to the implementation of something to which they were part of in the planning. So it's really having them be on the same boat with the organization as a whole insofar as the implementation of EMR is concerned. And also, there should be a reality checking, and it's part of that psychological element. The reality checking is that there should be a common expectation that the implementation of EMR would have its own sets of setbacks and problems and challenges. Okay, just so that on the initial phase of the implementation, if problems would arise, they won't easily be discouraged and they would totally abandon altogether the plan. It's because it's something a bit of expected already. So we are trying now to tone down and we are trying to set the expectations, and the expectations would really be equivalent to what is reality as going on. So aside from the technological barriers, aside from the other barriers, really, I think it's very important to get in touch with the human element, with the implementers, the main implementers for those, the healthcare professionals, the physicians, the nurses, and they try to think on how to win how to gain their confidence and support in its implementation, not just on the aspect of the economic side, the financial side, and even the technological side, the readiness, I'm talking of those, but you should also would want to have your implementers be ready, not just on the moment that it's being implemented, but readiness in terms of even planning for its implementation. They should be on board already.
Okay, thank you, Doctor. Now we have another question from Dia Ayu, Setia Malang. Dr. Amihan, what is your suggestion for the design IT in making friendly EMR for healthcare professionals? Thank you.
Okay, well, it's a bit easy. Supposedly, it's because the persons who would be able to identify whether you have already come up with a user-friendly interface for your EMR would be the end users. So it's important to gain feedback. It should be part of your implementation to gather regular feedback coming from the implementers and the patients, and including the physicians or the nurses. So they would be the ones to really continuously improve the system, including how user friendly that would be. So try to be grounded as much as possible, by getting data coming from the end users themselves, not just you reflecting as the manager or the owner, and then you would have your own way of assessing things. Then you may not really be grounded on reality and what's happening really in the ground. So better formulate and better integrate feedback monitoring mechanisms, so that there would be continuous updating and upgrading of your system, and then you would ultimately get your desired results with regards to having a user-friendly interface.
Okay, thank you, Dr. Amihan. Last question is from Norlinda from Malaysia. Do you find political changes and uncertainty influence in the government support towards the implementation of EMR in your country, Filipina, since its leaders have different views toward the importance of medical record in health facility? Thank you.
Well, this question is addressed to both of us. Am I right? Would it be okay, Miss Vicky? Who would be the first one to answer this question?
You can go first.
Okay. I would say yes, and we should embrace that. We should consider that when we try to implement something, really it's not just a matter of economic and nothing a matter of sociological and physiological and psychological. It also is influenced and sometimes dictated in certain degrees depending on the type of political maturity we have in our nations. But really, political changes would somehow influence the direction and the pace towards on how how fast should we keep up with the rest of the world with regards to EMR. Just like in our case, we somehow projected a rapid increase in the utilization of EMR because of the introduction of the universal healthcare law. I could just imagine that prior to that, there was no really national effort pushing a push coming from our political leaders so that healthcare systems would adapt to technology through EMR systems. But because of the push for universal healthcare law, giving access to healthcare services to as much people as possible, then it would entail that we need to adapt integrated systems, information that could be shared across the different healthcare sectors in the area in the Philippines. And another thing is that with the push also of the data protection law in the Philippines, and those are relatively new policies coming or legislations coming from the government, and it really did influence the direction of EMR and health information systems in the Philippines also. And the politics, in a sense, with regards to training of our healthcare professionals. Uh, Training, I would want to pounce on education, the higher education institutions, as really the main suppliers of the healthcare information of healthcare managers, EMR implementers, really. And the Commission on Higher Education is really hooked into the other agencies of our government. But even if we push as a general direction, because of our political leaders, we push for implementation of EMR and other things, there are still limitations with regards to um, advocating for the training towards EMR, healthcare information, in our curriculum, because there are so many other agencies and political leaders pushing for their own agenda and lobbying for those to be included in our curriculum. And because of that, we only have one subject, at least one subject per curriculum for allied health courses in the Philippines. In the nursing profession, they would only have informatics. In the medical technology profession, for the pharmacy curriculum, they only have limited courses that are really dedicated towards training the future healthcare professionals to be able to implement the EMR systems. And it's a reflection of our political push towards implementation of EMR insofar as the academe is concerned. So really, we are just part of that system, and we are influenced by the general directions of the political agenda of our nation.
Okay, thank you for the explanation. It's a very insightful, Doctor. Okay.
Yes. Now, I think in Australia, perhaps less impacted by some of the politics, because we've had universal health coverage in Australia for a very long time, and so there's been bipartisan support from both sort of sides of politics in Australia. But you would see more, I think, accurate where somewhere like the US, where under President Obama, they had Obamacare, and during that time there was significant legislative reform around ensuring that patients' information are able to be accessed right across the whole health system. I think you could definitely see the impact of that in America. In Australia, we have the National Australian Digital Health Agency, and it does work at the national level to try and have standards for digital implementation. It has in that program map that I showed in my presentation, there is a stream for workforce education, understanding that we need to have a digitally enabled workforce. So I think governments have a role to play there. They certainly, I mentioned a lot about funding, without, and that can be seen in different ways that certain sides of politics commit to funding these different things. I think largely though, what we see is the largest change in Australia is when patients themselves demand access to their information at the right place, at the right time. I can go to Indonesia tomorrow and put my card in an ATM machine and access my banking details, but I can't go from one hospital to another and have all of my patient records available to me there. And I think consumer sentiment and the demand that patients and consumers are going to put on healthcare systems and clinicians is going to be the thing that will drive change. They will, digital natives, as you put it, my kids, your kids, they're going to expect information available at the point of care from one facility to another, which means we'll have to have it as electronic documents and not just paper. There will be, I think, the drive from the consumers of healthcare services that will actually probably drive most of the change coming forward.
Okay, thank you, Mrs. Vicky. Okay, now before we go to the second panel discussion, we will have session documentation first. We will take picture for the speakers and the participants. Ini sebelum memasuki diskusi yang kedua, kita mau dokumentasikan dulu ya, untuk partisipan juga mau difoto-foto bareng-bareng. Itu mukanya tolong. Iya, benar. Wajahnya tolong ditampilkan biar ketahuan fresh, dapat ilmu bagus baru hari ini. Udah selesai sesi fotonya. Terima kasih. Okay, now we will come to the second panel discussion. Before that, we will have two speakers. First is Mr. Johari bin Mohammed, BPO Hans, Medical Records Officer, Head of Department Medical Record Sultanah Bahia Hospital, Malaysia. As you can see on your screen, Mr. Johari accepted Excellent Performance Award Kedah State Health in 2011 and 2019. Today, Mr. Johari bin Mohammed will talk about implementation of electronic medical record in patient clinical nursing care. Please welcome Mr. Johari. You will have 30 minutes for the presentation.
Can you hear me? Can you hear me? Bisa boleh tak? Oh dia nak kita punya. Yes. Let me. Yes. Yes. Itunya kan. Oke. Bisa dilihat saya.
Masih semangat ya. All the participants we will wait for Mr. Johari.
Boleh saya mau datang? Boleh. Can we start? At least katanya. Good morning.
Good morning, Mr. Johari. Time is yours.
Major Chairman. Let me thank the organizer for this opportunity to share our experience in using electronic medical record for almost 14 years in the hospital of Surabaya and Jakarta. I will be able to provide all of you the information and the details related to the future of my talk today, that is the implementation of electronic medical record in patient clinical decision. The outline of my talk today. First, we do the topic on overview, followed by what is electronic medical record, the benefit of electronic medical record, privacy and confidentiality, accessibility and availability. I will start on the overview of electronic medical record and the hospital where I come from. We can see in map at the northern part of Malaysia. That is the state hospital started in 1920 with only one block of two buildings. The new building, Hospital Surabaya, which operated in 2007. Since 2007, the hospital operational at two locations. The distance is about 5 kilometers. The whole hospital has 119 beds. The new building Surabaya has 918 beds. Both hospitals are connected and using electronic medical record. I will now on the element needed during the transformation to electronic medical record. First element is to decide on what type of medical record that the hospital is going to do. There are two types of electronic medical record. That is fully electronic, which is totally paperless, and hybrid, which is half electronic and half digital record. I would say we are using every type of electronic medical record. Second element is how to start the electronic medical record. Some hospitals start in stages based on the module. There only the registration module or only the information system module or fact for the review later immediate or may start totally information system. Third element is to build all the requirements. This will involve every department in the hospital as the electronic medical record. Type of laboratory, X-ray, or pharmacy, or clinical chart. For example, if developing a course both at the level and departmental level, this core team will play the important role during the implementation and through the use of electronic medical record in the hospital. The one is on training of the system. The training will cover all stages involved administrator, middle management, and staff. The policy related hospital and user experience which are prescribed by the hospital. Every hospital, every hospital using electronic medical record is needed to have a contingency plan. In the event of disaster, electric supply problem, system malfunction, server problem, or casualty incident to make sure the continuity of patient care. It is a legal patient record in a digital format. Involved in
Mr. Johari, I'm sorry, but we cannot hear your voice clearly.
yang
Maybe you could use your headphone or your earphone.
Testing. Oh, dia tak dengar. Kan.
Hello? Okay?
Yes, this is better. Thank you.
Okay. You want me to step? We continue. What is electronic medical record? It is a legal patient medical record which is a digital format involved in storing and organizing the record. Information included in the electronic medical record are patient demography, medical history, progress note, medication history, examination finding, and the diagnostic result. And next, in our setting, the responsibility of electronic medical record is under two departments. That is the Information and Technology Department, play the role in managing the hardware and software, and Medical Record Department play the major role in managing patient clinical records. The role of Medical Records Department in managing patient clinical care involves three categories. Number one, supervision of patient record, for example, do and don'ts in documentation of clinical notes, the availability of birth chart, patient chart, and diagnostic result. Number two, storage of the record, which involves the storing of hard copy records, and the safety of electronic medical record in terms of printing the record or sending images via electronic media. And number three, producing statistics for the hospital and medical report for the hospital or the patient. The implementation of electronic medical record in our hospital started with the new building, Hospital Sultan Abayah, in 2007, where the main operation is here. For example, the laboratory, the clinic critical care units, the CT scan or MRI, and the operation theatre. The old building that is Hospital Alostar, with about 5 kilometers distance, started with EMR about 12 years later in 2019. after installation of cable and upgrading the system and hardware to enable using hospital web in the old building. Patients are sent to the new building for certain procedures and samples are sent to the new hospital for tests in the main lab. But with electronic medical record, the result can be viewed immediately in the old building. The management of patients are better quality and ensure the continuity and collaboration of patient management. Right? I'm going to share the benefit of the benefit in using electronic medical record. First benefit of electronic medical record related to medical error. Number one, using electronic medical record eliminates medical error. There will be no more issues on handwriting that cannot be read. The text in electronic medical record is clear and no more confusion in reading for nursing care to be carried out. There will also documentation on past medical history, which can be easily accessed in electronic medical record, thus prevent errors in managing patients. Clinician will know better of patient status and this will help in making decisions on patient management. Number two, electronic medical record will prevent medication error. There is a function in electronic medical record as an alert system or notification to ensure proper dosage administration of medication. There is also an allergic notification as to prevent error in prescribing medication. Next. Kalau kita lihat di sini, misalnya kita ada kesulitan untuk membaca dokumentasi rekam medis pasien menggunakan tulisan tangan. Di sini juga hanya ada tanda tangan tanpa ada nama perawat. Okay, next. This slide show an image of electronic medical record that is being used in our hospital. An example on notification of allergy. As we can see here, in this patient chart, it is documented that paracetamol is an allergy to this patient. Therefore, the managing medical personnel is alert on the allergy immediately when viewing the patient chart. This will prevent medication error and ensure safety in patient management. Next. The diagnosis of the patient can also be viewed immediately when viewing the patient chart. We can see in this slide, the past diagnosis of the patient is documented. Once again, the managing medical personnel is able to know immediately the status of her patient. Therefore, there will be the continuity of management for the patient. Next. The second benefit of electronic medical record improve the quality of documentation of medical records. Number one, the time and date is auto-documented in the electronic medical record. That is during the documentation of note, or when entering the order for investigation, or medication order, or in any documentation entered in the health information system. So as the name of personnel, it is auto-documented based on the user login names and the title. Number two, the requirement on documentation can be present in the system data field. This data needs to be filled by the managing medical personnel. This will reduce the risk of missing data during documentation of the patient history or the physical findings. Number three, order of diagnostic tests are compulsory by the health information system. Thus, the documentation on all the tests and results will not be missed. Number four, the same goes for orders of procedure and medication, which is also compulsory in the health information system. Thus, no documentation will be missing. Next. Misalnya tidak ada catatan waktu pada dokumentasi rekod perubatan secara manual. Akan tetapi di dalam electronic medical record, catatan tanggal dan waktu akan direkam secara otomatis. Okay, next. This slide show an example of patient tracking notes which is put in the system. As required that data field, we can see the heading of the required field in tracking notes. That is information on trauma or non-trauma of type of trauma. The complaints, history of illness, family history, social history, and the heading in examination. That is general condition. Therefore, no important information is going to be missed in the documentation. Next. The third benefit of electronic medical record can improve the workflow of managing patient care. Electronic medical record allow immediate access to patient notes, access to diagnostic tests, and access to radiological image. This will result in early patient management. Documentation on lab test order will also be available. This will prevent unnecessary repeat of tests. Result of tests also will be able to view immediately. There will be no more issues of result delay due to human factor. At the same time, in emergency management of patient, repeat access of patient status, will surely provide benefit in the quality of care. Early patient management during the critical period will benefit in reduce the morbidity or prevent mortality. Nice. In this slide, we can see the previous history of patient encounter, the specialty or clinic that the patient has previously managed by. This will provide information on the patient's status of illness for continuation of current management. Next. Also in this slide, the managing clinician will be able to view the medication that the patient was prescribed. In case when patient has multiple clinic visits, the medication prescribed by the other doctors can be viewed by other managing doctors, therefore better quality of patient care. No same medication will be prescribed by different doctors, and no medication that may cross reaction will be prescribed at the same time. Next. Third benefit of electronic medical record, improve patient quality of care. The repeat access of patient medical records, the notes, the investigation result, the procedure done, and progress of patient, especially involving multidiscipline. We ensure collaborative management of patient care. And then, this slide shows all the diagnostic tests that have been done for the patient. The result of fresh investigation can also be viewed immediately. This will surely help in patient management. Next, the similar view of patient previous visit to other clinic. The information will give the managing medical personnel to knowledge on patient health status. Next, cost benefit of electronic medical record. Electronic medical record reduce cost of healthcare. In general, use of electronic medical record help in improving the costing of healthcare. Issue on human resource can be reduced. Less manpower for tracing results from the lab or tracing the medical records. No wasting in unnecessary repetition of diagnostic tests. Reduce the need of storage area for manual records. Next. Image show the manual record storage. This type of storage area needs human resource for tracing and storing the records. It also increases the risk of occupational disease in terms of breakage, fall, and others. This slide is to share the login page to the electronic medical record that we are using. The system is only accessible through the hospital database. No user can access the system with external network. The system is individually approached that is specific to one login, username and password. Each user has a specific responsibility which determined with level of accessibility to the system. Next. Who can access the system? The implementation of electronic medical record in a hospital require a policy and a user access policy. This is to ever decide by the hospital administrator and committee. The electronic medical record can only accessible through the hospital web, and it is only accessible by individual login and password. What is user access policy? It is the policy that states the level of accessible in electronic medical record based on the responsibility, meaning only clinician managing the patient can access the record. The user who will access the patient record can also be identified as it is auto-record in the system. And next. This benefit of electronic medical record maintain privacy and confidentiality. Patient records are only accessible by the managing medical personnel. No more record on table or counter. No sensitive diagnosis are accessible by others. I'm going to share the importance of contingency plan regard to electronic medical record, which has been experienced in our hospital. Tak ada kamera, Abang? Over the 14 years of using electronic medical record in our hospital, we have experienced 2 types of major downtime. There are 2 types of system downtime. The first type is planned downtime, in which it is carried out by the vendor to refresh the system and is planned during the less busy operating time in the hospital, usually after midnight, where the ward inpatient management is not busy and less crowd in the emergency department. The second type is unplanned downtime due to the problem in the system of server. The major downtime has occurred twice in our hospital. The longest period of downtime we have experienced is over 5 days due to the server problem. The contingency plan we have in our hospital in incident which cause slowness of the system will limit the user. The focus on uses of electronic medical record will be at critical areas, for example, emergency department and intensive critical units. Incident which cause total dysfunction of the health emergency system, the business continuity plan has allowed few functions. There is a laboratory information system to provide the previous data result and the ongoing result. The clocking notes will be documented in a different system, which will later be extracted. The previous and current pharmacy order can be retrieved from the server and provided by the BCP, the Business Continuity Plan. The Business Continuity Plan is to ensure the continuity of patient care. Next, I will discuss on the issue on storage of manual record versus electronic medical record. With the manual record, more space area will be needed for filing and storing the record. The structure of hospital buildings usually are not expandable. Limited space will be the main issue with the increased number of new patients. With the number of discharge in our hospital. With the number of discharge in our hospital, 75 or 18,000 per year, or about 200 discharge per day. The medical record department needs about 4 persons to handle the initial step of receiving the patient file, auditing, recording and sorting the file. which later will be handled by 3 other persons to store the file by the filing system. Another team will be involved to trace the patient file when needed, for example, during the process of preparing the medical report or during the follow-up visit in outpatient clinic or during the new patient admission. On the other hand, the hospital using electronic medical record will have no issues in storage space, even though has decreased number of new patients. The electronic medical record will depend on the memory and server unit available. The human resource will also not in an issue, as all the patient medical record is available and accessible by one touch. Semua di hujung jari saja. Next. This slide is to share with all of you the Archive Act in Malaysia. We state the time period for the patient medical record to be stored. The Act states that in the ordinary case, the record will require minimum of 7 years of storage. In the medical legal case, the record will require minimum of 7 years or until the case is settled, no more under the law of Act. In the psychiatric case, the record will require the storage until 3 years after the death of the patient. In the obstetric case, the record will require storage until minimum of 21 years. Whether in the pediatric case, the record storage require minimum of 7 years after the child is 18 years of age. Even with minimum period of 2 years, there will be over 2 times increase in the number of patient files. This will lead to overflow of patient file in medical record department. Finally, this slide shows other function of medical record department. The statistic of hospital can be rapidly extract from the electronic medical record. The statistic available in the electronic medical record, example for inpatient, outpatient procedure, workload for radiology or pathology department or forensic department. It can be extracted based on the required data. Furthermore, the medical reports can also be prepared immediately once applied by the patient. No tracing of the patient file needed. The confidential and safety of the patient medical record are secure. There is also less risk of missing file. The patient medical record for preparing the medical report is readily available and accessible at any time, regardless on weekend or public day off, where the medical record department is closed. The clinician will be able to prepare the report at their own available time. Next. From this slide, we can see there are many types of report and on statistic of patient nursing care can be obtained from the electronic medical record. It is divided by section for outpatient reports, official reports, and inpatient reports. The type of reports available can be requested or discussed with the vendor during the initial stage of implementation of electronic medical record. As was described earlier in my lecture, there is data requirement. This initial step is very important so as to facilitate the work process of all users. This shall be involved by the core team from all departments. And next. Example on inpatient reports, daily ward census, daily inpatient census by discipline. Okay, next. More example on other type of report available in electronic medical record. As we can see here, the census of inpatient, for example, daily inpatient census by specialty or nursing care or list of discharge by diagnosis. And next, this slide shows the report on bed availability in wards. With this data, it helps in giving information to the admission part. For example, the emergency department on bed vacancy in ward, which ward has an empty bed. The BOR in our hospital is around 85%. The availability of this data in electronic medical record eliminates the need of calling ward in order to know the bed vacancy. Clinician staff can focus more in nursing care rather than finding the bed of admission. In summary, electronic medical record provide proper medical record management, which benefit the healthcare provider and patient for the better patient care. Setiap sistem manajemen rekam medis memiliki kelebihan dan kekurangan masing-masing. Yang penting ada manfaat lebih. Kalau manfaat lebih, maka sistem bisa digunakan. Yang lebih penting adalah persiapan kita sebagai pengguna sistem. Kita perlu berfikir positif dan bersedia menerima perubahan apapun. Sekian, terima kasih. Thank you very much.
Thank you, Mr. Johari, for the great presentation. Thank you. So, according Mr. Johari, EMR are digital version of the paper chart in clinical officer, clinics, and hospital. And the benefits for the patient are fewer errors compared paper records, better and quicker care, track result, and data over time. And for clinics, save space, optimize workflow, and lower optimal operational cost. Manfaat bagi pasien untuk EMR ini, jadi lebih sedikit kesalahan dibandingkan dengan catatan kertas. Perawatan yang lebih baik dan lebih cepat. Melacak hasil data dari waktu ke waktu lebih mudah. Kalau untuk klinik, manfaatnya hemat ruang, optimal alur kerjanya itu lebih maksimal, dan biaya operasionalnya lebih rendah. Oke, now the fourth speaker is Mrs. Alice Carmelia. Mrs. Alice Carmelia is lecturer from Polytechnic Semarang. As you can see the resume on your screen, she works as experienced government employee at Harapan Kita Hospital since 1979 until 2016. Wow. And for the organizational experiments, head of organizational division of DPD Pormiki DKI Jakarta, 2006 until 2009, President of Pormiki, and then 2009-2012, pioneer of formation of Aptimiki 2011, and President of Pormiki 2012 until 2015. Today, Mrs. Alice, we will talk about the him of role in health service facilities on the implementation of EMR as embodiment of the Industrial Revolution 4.0. Please welcome Mrs. Alice.
Thank you, Miss Soraya. Panitia, saya akan share screen sendiri karena ada revisi sedikit.
Iya, Bu Elis.
Sudah kelihatan?
Udah, ya.
Slide presentation.
Yes, we can see it, Mrs. Alice.
Yes. Thank you. Selamat pagi, good morning, I think. Oh no, good afternoon. It is almost 11 o'clock. So please allow me to use English and Indonesia for this presentation, Ms. Soraya.
Yes, Mrs. Alice.
Okay, thank you. My title of this presentation, the HIM role in health services facility on the implementation of EMR. So the topic, introduction, HIM competency, EMR services on health facility, government program of development health IT, EMR adoption model, management document to EMR implementation, and how the EMR or EHR in Indonesia. So we ask for by myself when people want fast in health services. When the doctors and health workers need efficient and effective services. And when the HIM professionals or PMIK need medical record services with information technology. And how is EMR competent to optimization services for HIM? So this is the question. And we know many participants asked to speak about the regulation of implementation the EMR in Australia. So in Indonesia, we have the regulation of the health workers, rule of the Ministry of Health about the medical record, role of the Ministry of Health about the HIM services organizing authority, and role of Ministry of Health about the career development for government employee functional and credit score, role of Ministry of Health about health information system in Indonesia, role of Ministry of Health about the health worker registration, and the last role of for the Ministry of Health about the professional standard, and we have a rule of ITE about the electronic IT, and a rule of by the Ministry of Communication and Information. And the last, we have application e-signature by rule of National Certification Board. Now, definition of the medical record are documents regarding patient identity, examination, treatment, and other services to patient at health facility. A health facility is a tool and or place used to provide healthcare services, both promotive, preventive, curative, rehabilitative, carried out by the government, regional government, and or the community. And HIM or PMIK is someone who has asked of the RMK or management of information or HIM education. PMIK is the association of universities in the field of RMK or MIK or HIM. And the PMIK is a PMIK or HIM professional organization in Indonesia. The name is PMIK. And IHIMA is a collection of professional organization at the international level. So, sahabat PMIK yang hadir di sini, kalian beruntung karena Presiden-elect 2022 sampai 2025 adalah Mrs. Vicky Bennett. Vicky, I tell the participant that you are the president-elect of Ismrh. So the committee, we have health encouragement of the profession. We have a guideline, standard of HIM services, standard of equipment. And as a profession, we have a professional standard, competency standard, education standard, curriculum standard, exit exam, educational level. And for the confession, we have a certification, but in progress. And all professional as a HIM, they need the registration. We call that SR and licensee by the STP. Now, the profile of graduation of the HIM, we have 2 vocational education, Diploma 3, Paramita, 62 institutions in Indonesia, and we have Diploma 4, Bachelor Applied of Health Information Management. We have 12 institutions. So this is the profile of a graduate of the Diploma 3 as a coordinator, clinical coder, health information manager. And the profile of Diploma 4, manager of quality, further reimbursement, and analysis of health information. This is the educational level, professional, Diploma 3, Diploma 4, Bachelor of Applied, and next future we have a Master of Degree in progress, and all of the graduation we call the HIM or PMIK. Now, this is the HIM competency, and we describe by the POHON competency 3, and we have 7 competency. So the first, high professionalism, ethics and legal. The second, introspection and self-development. The third, effective communication. 4, management of health data and information. 5th, skill of clinical classification, codification of disease and problem, other health and clinical procedure. The 6th, application of health statistics, basic epidemiology and biomedicine. The 7th, HIM services for management. This is called competency 3 for HIM. Now, we describe for the 4, 5, 6, and 7 because the first, the second, and the 3, that is the wajib ya, wajib nomor 1 dan 2 dan 3. Okay. This is a HIM competency for competency, health information and data management, design of health data standard, management of health data and information, utilization of data and information to support disease health, and use of health information system in data management. And the fifth skills area of clinical classification, codification of disease and problem of other health, the clinic and clinical procedure. Understanding the concept of clinical classification, use of different types of clinical classification. Now in Indonesia, we use the ICD-10 and ICD-9-CM, and also ICD-O, ICD-F for disability, and other only just introduced. Okay, for six him competence to supply or to the electronic medical record. This is the application of statistics in the processing, presentation of data and health information. I see the presentation for Mr. Johari. The statistic is automatically output by electronic medical record. So application of basic epidemiology in program design and health data analysis, application of biomedicine in understanding characteristic and health data, meaning of health data. Now, SIM competency for the seventh service management area. This is collecting data on health services program, manual and electronic, and manual processing of health services and program data and electronic, manual presentation of health services and program data, manual and electronic, data analysis of health services and program manual and electronic, and HIM services for quality management. So, in this red text, I mark that the role of HIM at MRAM is to monitor evaluation of what we usually call the number of incomplete medical records filing, but this task is getting higher in EMR technology. So this is Indonesia have the education for diplomacy, bachelor applied, academic, bachelor academic, bachelor science, and bachelor master of degree in progress. Now we have government regulation for health information system, like the Article 40, that each health services facility must operate its own electronic medical record. Now, health information management system to the electronic medical record. Hospital information management system herein after created or as a CRS is a communication information technology system that processes and integrates the entire flow of hospital service process in the form of a network of coordination, reporting, and administrative procedure to obtain precise and accurate information, and is part of the health information system. Now, in this fair, you can see a very busy person, they or we can something to be fast and dynamic. So in this fast-paced digital technological sophisticated continue to evolve of change every second. In services or hospital, we hope we need the digital technology by EMR, EHR, or health. Like this is a transformation of the services, hospital services. The last and now. How physical description for health information, hospital information management system, expectancy for the customer, like toy list, outpatient. Every doctor desk in the polyclinic is provided with a PC, and doctor need a mobile application for hospital employee and patient, and the nurse station with a central monitor. So this is nursing easy to monitor many patients in the world, and a mobile system like a gadget to access medical record. So all of the clinical and administrative will be integrated services. This is a EMR, like Mr. Johari told that the EMR make the hospital efficient, effective, and on health services, and many benefits for them. Like we have computer on wheel on board, EMR accessed by health workers in operating theater or operating room, and updated if needed. Easy. Access easy on the board. We have some hospitals to be running the electronic medical record, like vertical hospital by Ministry of Health. This is the definition or pengertian tentang apa itu rekam medis elektronik atau electronic medical record yang dijalankan dalam satu rumah sakit. Sedangkan rekam kesehatan elektronik dijalankan dengan beberapa lebih dari satu organisasi pelayanan kesehatan. Sedangkan rekam kesehatan personal adalah rekaman catatan elektronik tentang informasi pasien yang dikendalikan oleh individu atau pasien. This is definition, different definition by the electronic medical record, electronic health record, electronic personal record. Difference by Nahid report. So, bedakan kebutuhan rekam medis elektronik, rekam kesehatan elektronik, rekam kesehatan personal. You can see that the Wikipedia describe about the electronic medical record. It's very high cost. So, if the electronic medical record make for many hospitals to be the electronic health record, it is maybe reduce of the cost. This is a function of the electronic medical record, bahwa fungsi utama dan fungsi lainnya mungkin partisipan bisa melihat tentang fungsi utamanya adalah data dan informasi kesehatan. Kemudian tadi sudah dijelaskan juga oleh Mr. Johari, ya. Kemudian manajemen hasil atau result management, order entry, decision support, dan fungsi lainnya adalah communication of connectivity elektronik, kemudian dukungan bagi pasien, ya, dukungan bagi pasien. Ada format atau template tentang materi promosi kesehatan, ya. Secara administratif akan memudahkan proses penjadwalan, ya, penjadwalan operasi, penjadwalan dokter, permintaan dokter, ya, kemudian sistem perjanjian, appointment system, otorisasi, verifikasi, asuransi, kemudian pelaporan dan kesehatan masyarakat itu sangat akan menunjang fungsi lainnya. Ya. The institute described that how about the functional of the electronic medical record and other supply of the electronic medical record. You know what is the health? We know the telemedicine, we know the management of patient information, we know the legal and ethical framework for e-health, and we know e-health policy, a systematic review, and we know e-health condition action, e-learning, and e-health quality profile. But in Indonesia, we have not yet regulation, sebab masih dalam progres terus tentang running of the electronic medical record. So, I am a member of HIMSS, who we know running of the electronic medical record, we have a stage for 0 to 7. This is the electronic medical record adoption model cumulative possibilities by SIM. Oh, not SIM, HIMSS. HIMSS. So, what is the stage 0? The 3 ancillary are not installed yet. It's okay. You have LIS, Laboratory Information System. You have not
Who else? Mrs. else? We cannot hear you. Mrs. Alice? Sembari nunggu Mrs. Els, sepertinya ada jaringan di koneksinya ya. Masih semangat, tetap semangat ya. Hari ini we have very great speakers, very insightful material. I'm enjoying the presentation from the speakers. Okay, while we are waiting for Mrs. Ellis, I will read the question for Mr. Johari. The first, let me read. Hi, Mr. Johari. My name is Nurlinda from Malaysia, Departemen Negeri Sembilan State Health Department. As the head of the department, do you mind sharing how does your hospital overcome issues concerning human and system error? And the second is, how much is the involvement of your record department in the hospital data security committee, given there are user logs and as such? Is there special features in the system that instantly trigger alleged hacking or breach of data? Thank you, Mr. Johari.
Okey, izinkan saya menjawab dalam bahasa Malaysia. Berkaitan dengan kita wujudkan satu komiti lah. Satu komiti perlu diwujudkan dalam mulakan suatu electronic medical record. Perlu ada satu komiti yang akan membincangkan berkaitan dengan level of error contingency. Jika terdapat human error seperti registration, jadi kita akan ada satu function yang akan ada, iaitu kita boleh merge the ID of patient, ataupun kita boleh betulkan kesilapan-kesilapan di dalam pendaftaran tersebut. Okay. Jika nota pesakit itu salah ataupun kesilapan pada nota patient, kita akan ada jawatankuasa yang melibatkan clinician. Jadi jawatankuasa ini akan membincangkan apakah bentuk kesalahan dan apakah tindakan yang perlu kita ambil. Okay, berkaitan dengan data, kebocoran data atau breach of data, jadi selama 14 tahun ni tidak berlaku hackers ataupun kebocoran data kerana kita menggunakan in-house punya database.
Okay. Okay, thank you, Mr. Johari. I will read the next question. My name is Cynthia from Bekasi, Indonesia. Apa saja tantangan Bapak di Malaysia when implemented EMR pertama kalinya, for the first time. Dan bagaimana cara Bapak mengatasi itu? Lalu kami sebagai pelaksana rekam medis, apa yang sebaiknya kami persiapkan dalam menghadapi IMR ini? Terima kasih, Pak.
Oke. Pada permulaan untuk mulakan EMR, kita memang akan menghadapi tentangan daripada terutamanya dari senior clinician atau senior nurse atau staff-staff yang senior. Jadi dia orang akan macam-macam berbagai komplain akan dinyatakan bila kita nak mulakan sesuatu sistem elektronik medical record. Jadi apa yang kita mulakan adalah kita permulaan pada 2 tahun yang pertama ini kita beri awareness kepada semua staff, semua clinician, bagi awareness, kita wujudkan core team. Setiap department di dalam hospital perlu ada core team yang kita akan lantik wakil dari setiap department, yang wakil ini akan kita bawa, akan kita terangkan berkaitan dengan electronic medical record. Dan ada keadaan kita bawa wakil-wakil ini untuk melawat hospital-hospital yang menggunakan EMR, supaya dia orang ni wakil-wakil ini dapat tahu kepentingan menggunakan EMR, dan EMR ini memudahkan mereka bila mereka melakukan suatu pekerjaan. Okay.
Iya, terima kasih Mr. Johari. Oke, sepertinya Bu El sudah kembali masuk.
Thank you, Miss Soraya. I'm sorry, very sorry. Light off.
It's okay, Mrs. L.
Okay. We will continue.
Yes, please.
Okay.
Mrs. L, you still have time, like 10 more minutes.
Okay,
Yes.
10 more minutes. Okay.
Yes.
This is a second. My voice is clear. Suara saya jelas. Bisa didengar? Halo?
Ya bisa, Bu.
Saya? Oke.
Bisa.
Ketika saya lanjutkan lagi, mohon maaf partisipan. I'm sorry. Second stage, all supply, yeah, medical supply already installed, yeah. Radiology, laboratory, pharmacy, PAC system. I saw that Mr. Johari is already four installed. So this is a state main online diagnostic system installed. Now state 2 is for clinical data room, but I'm sorry, this red text, when I mark that the role of him at MRAM is to monitor evaluation, or what we usually call the number of incomplete medical record. Ya, biasanya kita mengatakan incomplete medical record atau AKP-LRM. Perhatikan nomor 3, CDR provide access to 95% dari laboratorium result. Jadi angka ketidaklengkapan pada pengisian laboratorium, lembar radiologi dan kardiologi akan dimonitor oleh PMIK, ya. Jadi role of the HIM about the incomplete medical record filing, but this task is getting higher in EMR technology, so that additional knowledge is needed, knowledge updated and specifikasi, especially for diploma before or bachelor applied. This is a stage 3 maintenance documentation is online. So number 1 and number 2 kompetensi dari PMIK, perannya PMIK. Stage 4 doctor's order or instruction, CPOA usage criteria set as more than 50%. Use the same matrix before use. Like this, for 1, 2, this is the role of the HIM. Take 5, number 1, number 3, number 4, role of HIM. Depend on the education. This is a 1 for stage 6. 1 is AKPLRM, incomplete medical report. Stage 7, management CPOA or medical. Number 3 and 4, role of the HIM. So, challenge and opportunity for the implementation electronic medical record, klasifikasi and coding. Kita tahu bahwa banyak sekali yang terintegrasi, ya, mulai dari diagnosis sampai dengan pengkodean. Kemudian klaim BPJS juga terkait dengan klasifikasi dan coding. Privacy and security, informatic and data analytic, clinical documentation improving, information governance. This is the definition of the HIMSS. This is a from paper to hybrid to electronic. Nah, di sini adalah ketika ada transformasi manual medical record to hybrid system and to be electronic health record, you can see the guideline for the IFIMA. When the Ms. Vicky told that about the electronic medical record manual to electronic. This is a management of electronic. Jadi data lama jangan dibuang, itu harus di-scan sebelum menjadi electronic medical record. Panduan tentang ini ada di guideline IFIMA. Ya, nanti tinggal buka saja browsing tentang IFIMA, itu ada tentang petunjuk atau pedoman rekam medis manual ke elektronik. Ya, nah, health information system in Indonesia, we have 2,600 hospital and 10,000 primary health care. We have this health information management, hospital information management, only hospital management by vendor. It's hospital by vendor. And we have a health information, hospital information system by the Ministry of Health. All hospitals in Indonesia use this. For this router, this is a health information for reference patient by hospital. CCARS, health information system for accreditation, and we also running the e-health by the Ministry of Health, already 137 hospital. I think it's only 10%. Miss Vicky thought that Australia already 56% hospital. But Indonesia trial only 10%. Private hospital, EMR by company. If one company have 5 hospitals, so they already running about the electronic medical record. And the last, we have a COVID reporting by the Ministry of Health system. This is the smart hospital, smart home care, and other. And the conclusion is HIM must continue to learn according to IT developments to support government program in the health information system toward electronic health record. The application of EMR must consider the all patient data that is integrated into the electronic medical record. The role of HIM in the application of EMR can perform an analysis of the completeness of the filing, which is used as an indicator of success according to the EMR level. We have not yet regulation of EMR or its EHR, and we have not yet standard data, especially for health data dictionary. So we agree, or I agree, always say yes when asked to engage in the opportunity. Vicky. So, okay, thank you very much for the attention. I'm sorry of the
Thank you, Mrs. Alice, for the great presentation. So it's better we say yes for the changes. Okay. According to Mrs. Alice, SIM must continue to learn according to IT development to support government programs in the health information system towards ESR. And the role of HIM in the application of EMR can perform analysis of the completeness of the filing which is used as indicator of success according to the EMSR level. Jadi menurut penjelasan dari Bu Els bisa disimpulkan aplikasi dari EMR harus mempertimbangkan data pasien yang lama agar dapat diintegrasikan di EMR. Dan peranan dari manajemen informasi kesehatan untuk EMR itu bisa mempermudah kita menganalisa kelengkapan dalam filing dan digunakan sebagai salah satu indikator dari keberhasilan level dari EMR. Okay, now it's come to second panel discussion. Okay, udah ada yang masuk pertanyaan. I will read from Yusrian Syah, Klinik UB. Bu Elis, bagaimana dengan tanda tangan pada general consent atau inform consent dan sebagainya baik dari petugas medis maupun pasien? Apakah di Indonesia sudah diperbolehkan pada EMR? Karena klinik kami berharap sudah memulai EMR mulai dari tahun 2018. Hanya terkendala surat yang butuh tanda tangan basah. Jadi kami memakai kertas biasa. Terima kasih.
Baik, dari siapa? Indonesia, saya bahasa
dari
ya.
Klinik UB, Bu.
Dari?
Klinik Universitas Brawijaya.
Oke.
Iya.
Untuk tanda tangan elektronik, yang kita ketahui bahwa inform consent itu ditandatangani oleh dua. Satu oleh dokter sebagai pemberi informasi, yang kedua oleh pasien atau wakil yang menerima informasi. Itu menurut KARS harus ada dua. Nah, dari dua itu kita tahu bahwa kalau tenaga kesehatan menggunakan electronic signature tadi, tapi pasien tetap tidak bisa. Karena kenapa? Kalau tenaga kesehatan bisa didaftarkan atau dia bisa menggunakan, tetapi pasien tidak bisa, sehingga tetap inform consent itu di-print untuk ditandatangani oleh pasien. Nah, bagaimana penggunaan e-signature oleh tenaga kesehatan? Saat ini boleh menggunakan berdasarkan peraturan dari BNS, Badan Nasional Sertifikasi Tanda Tangan. Tapi tanda tangan tersebut harus didaftarkan dahulu, ya. Daftarkan dahulu baru menggunakan e-signature. Tapi untuk inform consent, si pasien kan nggak didaftarkan namanya ke BNS, ya. Jadi tetap masih menggunakan apa namanya paper ya, paper yang
Oh,
disimpan.
iya, baik Bu Els. Ini ada penanya lagi, ada yang raise hand ya ini. Silakan. Ya resen dulu, saya udah bilang resen. Iya, oke, silahkan Mbak Vicky.
Halo Bu Els, kenalkan nama saya Vicky dari STIA Malang Indonesia. Saya izin bertanya kepada Ibu tentang bagaimana menurut Ibu kompetensi 1, 2, 3 dalam pelaksanaan IMR. Terima kasih.
Baik, terima kasih untuk Vicky Amalia ya. Vicky Amalia, tadi dikatakan bahwa kita punya pohon kompetensi. Ada kompetensi 1, 2, dan 3 itu wajib sebetulnya bagi seluruh PMIK. Sementara kompetensi 4, 5, dan 6 dan 7 itu juga wajib karena kompetensi. Tetapi harus dilihat lagi levelingnya, apakah dia diploma 3 atau diploma 4 atau S1 atau master ya. Jadi three competency are as drawn in the competency of three, competency 3. Each of these sub competency is a foundation that must be possessed by PMIK. Ya. Iya.
Iya, thank you Bu Els. Semoga menjawab pertanyaannya Vicky ya. Oke, Bu Els, pertanyaan terakhir dari Ahmad Arif. Apakah dalam penyusunan IRAM juga harus sinkron dengan HL7, Health Level 7 Internasional? Terima kasih.
Ya, Ahmad, dari mana? Dari Malang ya?
Iya,
jadi,
dari Malang.
Tadi dikatakan bahwa regulasi kita belum ada. Sedang in progress sebetulnya karena ada revisi terhadap Permenkes 269 untuk electronic medical record. Walaupun kita sudah punya regulasi nomor 46 tentang SIK yang mengatakan bahwa penggunaan disetujui penggunaan tentang electronic medical record. Namun pada dasarnya penggunaan HL7 itu sebetulnya sudah dilakukan di beberapa rumah sakit, ya. Tapi untuk standarisasi, nah tadi Miss Vicky juga mengatakan bahwa harus terstandar. Apa standarnya? Operability, ya. Operability bisa menggunakan apa? Salah satunya mungkin HL7. Ya, belum ditentukan tentang standarnya, ya, baru standar klasifikasi dan kodifikasi. Kemudian standar datanya belum semua, bahkan HDD Health Data Dictionary-nya belum full, walaupun sudah ada dari Kemenkes ya, the Ministry of Health, Center of Data and Information already arrange of the data ya, dictionary tadi, tapi belum diresmikan, belum ada. Itu ya, Ahmad.
Ya, thank you.
Jadi penggunaan XL7 juga termasuk yang diperbincangkan untuk interoperability ya sebagai standar, tapi belum keluar.
Oke.
Saya nggak tahu, mungkin Mr. Johari apakah sudah menggunakan HL7? Belum ya?
Belum.
Belum ya, untuk interoperability-nya karena elektronik medical record-nya baru rumah sakitnya Mr. Johari ya? Belum
gunakan.
Oh ya, jadi belum data exchange ya? Ya, jadi kita juga belum, tapi mungkin ada rumah sakit besar, satu perusahaan mempunyai lima rumah sakit, itu mungkin sudah menggunakan SL7, tapi secara resmi SL7 itu belum distandarisasi.
Oke, terima kasih Bu Elis untuk penjelasannya. Thank you Mr. Johari. Ladies and gentlemen, we finally come to the end of the seminar. I'm Soraya as the moderator who would like thank you for all of these 4 speakers for attending, for following the whole seminar and for till the first until the end. I like to thank you for the informative and very insightful knowledge for today and for all the participants and very active participants. Before we close this, we would like to have last picture, take picture for all the speaker and all the participants. Yang kameranya belum dinyalain ya, sesi foto-foto. Okay, thank you once again for Mrs. Vicky Bene, for Dr. Amihan, for Mr. Johari, for Mrs. Ellis, for the time and give the speakers with a beautiful and detailed presentation. Thank you for today. I hope we will meet again for next time. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Masuk. Ini terus. Udah?
Terima kasih.
Terima kasih.
Ya, terima kasih Mr. Johari.
Terus ditutup.
Oke, terima kasih Dr. Elis.
Ketemu lagi. Udah.
Oke. Habis ya?
Closing.
Thank you to Ms. Soraya as the moderator of International Seminar 2021. All right, ladies and gentlemen, next is door prize season. To Dea and Ika, time is yours.
Okay, thank you MC for the time. Good morning everybody.
Good morning. Previously, thank you also to the speakers, Mrs. Vicky Bennett, Mr. Sulilo R. Amihan,
Mr. Johari bin Mohammed, and Mrs. Alice Carmelia.
Yeah, thank you for the material and knowledge that has been given. Hopefully it can be useful for all of us. Amin.
Amin. Kak, ini ada apa ya Kak? Kok ada kursi-kursi Kak?
Ada apa ya kira-kira? Kayaknya panitia punya kejutan deh buat kita.
Iya kira-kira ya. Ada apa ya?
Jangan lift dulu makanya ya.
Sebelumnya kita mau menyapa dulu Halo Rekameders, walaupun kita bertemu secara virtual, tapi tidak sedikit pun mengurangi antusias teman-teman untuk mengikuti acara seminar internasional ini.
Iya benar banget. Sebelumnya perkenalan diri dulu kali ya. Perkenalkan, nama aku Ika Fitria Nuroma dan tentunya di sini aku nggak sendirian, aku ditemenin sama teman aku.
Halo, namaku Delviana Isnaini, panggil aja Dea.
Gimana nih, masih pada semangat nggak? Masih pada semangat?
Harusnya sih pada masih semangat ya.
Iya harus dong ya, walaupun diselenggarakan secara virtual. Oh iya teman-teman, sekedar info, sebenarnya kita tuh kedatangan sama pemateri yang luar biasa banget loh. Baru pertama kali ngisi di seminar di sini, tapi kalian ada yang tahu nggak siapa itu yang luar biasa?
Wah masa sih Kak?
Iya, ada yang luar biasa.
Pada tahu nggak? Teman-teman pada tahu nggak?
Ada yang tahu nggak? Jadi pematerinya itu namanya Miss Vicky Bennett. Beliau adalah Presiden Pormiki sedunia loh, luar biasa banget kan? Luar biasa.
Iya teman-teman, kapan lagi kita dapat pemateri sehebat beliau-beliau ini?
Iya bener banget, gak cuman Miss Vicky Bennett aja, tapi ada pemateri-pemateri hebat lainnya seperti Dr. Shirley Low, Mr. Johari bin Mohammed, dan Mrs. Alice Carmelia yang tentunya gak kalah hebat ya. Gimana?
Iya dong.
Iya dong. Oh iya, teman-teman juga jangan lupa ya, stay safe, selalu taati protokol kesehatan dimanapun kalian berada.
Oh iya, jangan lupa untuk teman-teman juga ikuti aturan pemerintah untuk vaksin ya, agar virus corona ini cepat berlalu.
Iya benar.
Stay safe ya teman-teman.
Stay safe. Setelah fokus memperhatikan seminar yang udah dari tadi disampaikan sama pemateri-pemateri hebat kita ini, gimana kalau saatnya kita santai-santai, refreshing?
Boleh tuh Kak. Iya boleh.
Kita mau ngapain sih di sini?
Kita mau ngapain ya kira-kira?
Gimana kalau kita main kuis aja? Seru kayaknya ya.
Ayo.
Iya, jadi walaupun acaranya virtual, kita tetap nyediain door prize ya, teman-teman. Jadi nggak usah khawatir. Gimana caranya dapat door prize?
Sebelumnya Kak Ika akan membacakan cara itu Kak,
Cara
yang
apa?
masuk brosur itu loh Kak.
Oh iya, yang masuk brosur ada tak? Oh iya, tak bacain aja ya.
Yang akses itu loh.
Soalnya pasti banyak nih dari peserta yang udah tahu sama gamesnya, tapi tak jelasin aja ya cara mainnya. Yang pertama, silahkan untuk panitia bisa share screen. Untuk kuisnya, pasti udah banyak yang tahu ini. Iya, yang ada di layar kalian ya. Itu nanti cara mainnya, you can access joinmyquiz.com. You can access joinmyquiz.com in your browser. Kemudian tinggal masukkan kode yang udah tertera di layar kalian ya. Ayo, siapa nih yang mau ikut?
Ayo.
Tenang
Teman-teman,
aja, ini ada door prize-nya.
nanti ada door prize-nya
Iya,
loh.
Ada door prize-nya, jadi nggak usah sedih.
Langsung aja diakses di browser kalian masing-masing ya teman-teman.
Iya, monggo diakses.
Nanti door prize-nya sangat menarik ya Kak Ika.
Iya dong, menarik sekali. Dikasih tahu apa enggak ini door prize-nya? Kasih tahu enggak?
Jangan dong, ini kan nanti kejutan.
Oh, kejutan. Nih siapa itu yang udah ikut? Ada berapa?
Udah ada 4 yang join. Ayo yang lain.
Ayo yang lain. Pasti pada mau dapat door prize kan ini? Iyalah, masa enggak?
Udah 10, ayo yang lain.
Kayaknya pada excited semua ini. Dikasih bocoran aja kali ya?
Boleh.
Door prize-nya nanti yang juara 1 dapat uang sebesar Rp100.000. Lumayan kan? Oh, voucher.
Oh iya, sama
bisa
voucher.
request uang atau voucher ya. Oke, this quiz can be taken.
Sudah 31 peserta.
Semuanya bisa ikut kok. This quiz can be taken by all participants. Tenang aja. Kita nggak banyak bahasa Inggris ya, Deh. Nggak bisa bahasa Inggris kita.
Iya, kita nggak bisa bahasa Inggris.
Iya, bahasa Indonesia saja ya. Ayo, berapa ini yang ikut? Oh, 61, 62 terus bertambah.
Ayo tambah terus. Tambah terus.
Gampang kok kuisnya ya.
Gampang banget. Untuk mendapatkan door prize yang menarik tadi,
Iya.
kuisnya pun juga oke lah.
Juga apa nih?
Juga
gampang banget ya.
Gampang banget itu.
Ayo udah berapa ini yang ikut? 80 ya?
Iya 80. 81.
Bisa ini nambah lagi. Itu tadi baru juara 1 ya dapat voucher 100.000. Nanti yang juara 2 dapat berapa deh?
Yang juara 2 dapat 75.
Yang juara 3?
Yang juara 3 dapat 50.000. Kan
Iya,
lumayan kan?
Lumayan banget buat beli permen dapat berapa itu ya? Lumayan banget kan? Ayo. Ini udah berapa? Wih, udah banyak nih.
Lebih.
Excited banget ini teman-teman semuanya ya. Mohon maaf mungkin dari yang peserta luar negeri bisa join. You can join this quiz. You can access joinmyquiz.com in your browser and input the code. Oke, berapa ini yang ikut? Udah ada 200 belum?
Belum Kak, belum.
Ini nunggu
Ayo
lagi
yang
langsung
lain.
dimulai ini.
Ayo teman-teman.
Ayo dong. Ayo ditunggu.
Kita tunggu sampai berapa peserta ya Kak ini?
Sampai berapa ya?
Berapa ya?
Itu udah berapa sih? 100?
Itu udah 127 kayaknya.
Iya, kita tunggu. Minimal 150.
Ya.
Kita langsung mulai ya. Ayo jangan sampai ketinggalan.
Udah 130.
Iya, sambil nunggu ini kita ngomongin kira-kira kejutannya panitia apa ya?
Iya, kira-kira kejutannya apa ya teman-teman?
Banyak banget nih kejutannya. Dari tadi pembukaan udah ada tari dari kakak-kakak rumpun seni yang luar biasa hebatnya. Terus kita juga ada pemateri-pemateri yang
sangat luar biasa juga tentunya.
Bener banget. Sekarang kita mau adalah apa lagi nih?
Ada kejutan untuk peserta-peserta seminar internasional ini. Jadi teman-teman jangan live dulu ya.
Iya. Ini untuk kakak-kakak panitia, linknya udah di-share kah di kolom chat? Ya, bisa langsung klik linknya, bisa langsung join kuisnya. Nggak jauh-jauh kok dari materi hari ini.
Udah berapa tuh Kak?
Udah
100. Oh, udah 150 lebih ya?
Ini masih nambah lagi apa dimulai? Dimulai aja kali ya?
Ini dimulai aja kan ya?
Oh, masih bertambah.
Ya, masih bertambah.
Iya, kita tunggu ya.
Sampai 200 kalian kali ya, Kak?
Iya ya. Cuman kayaknya ini banyak yang excited banget.
Ayo, teman-teman.
Ayo, teman-teman. Tunggu. Jangan deh 1 menit aja ya. Kelamaan kalau 5 menit.
Ayo, udah berapa itu? Udah 170, ayo. Terus. Teman-teman yang lain.
Ini panitia boleh ikut apa enggak ya? Panitia boleh ikut
Panitia
apa
boleh
enggak
ikut kok.
Boleh, tapi nanti nggak dapat hadiah ya meskipun menang. Iya. Nunggu 200, tinggal berapa orang ini?
Udah berapa itu ya? 180 lebih kayaknya itu.
Ini masih
180.
bertambah apa enggak ini?
Oh, 188.
Tunggu 200.
Tunggu 200.
Iya.
Langsung dimulai kalau udah 200. 189.
Ayo 10 orang lagi. Langsung kita mulai kuisnya.
190. Ayo kurang 9 orang lagi. Ayo kurang 8 orang lagi.
Ayo siapa yang mau jadi bagian dari keseruan kuis ini?
Kurang 6 orang ayo. Kurang 5 orang lagi Kak Ika.
Cepet ini memang.
Abis ini langsung kita mulai.
Iya, benar banget. Nanti Dea ya yang mulai. Udah? Udah, mulai.
Langsung.
Ayo Dea, kita mulai. Ya, start.
Jangan lupa masukin kodenya ya.
Jangan sampai salah.
Jangan sampai salah kodenya.
Betul.
Oke, 3, 2, 1, go. Ayo. Wis, siapa ini?
Aduh, siapa itu? Ini nggak ada dari asalnya mana gitu ya? Seru banget sebenarnya.
Dari siapa? Ramadan. Terus siapa tuh? Wiwit. Ayo. Wiwit menempati urutan pertama.
Urutan pertama, jangan sampai kalah sama Mbak Wiwit ini. Mbak Wiwit ini potensinya menjadi iya.
Dan urutan kedua, siapa tuh Kak Ika?
Ada siapa ya?
Oh, urutan pertama digantikan oleh Irian Hospital atau siapa ya itu?
Intan.
Oh, Intan.
Mbak Wiwit nggak jadi ya di posisi pertama. Yang posisi kedua siapa?
Mbak Wiwit nggak jadi yang pertama. Yang urutan kedua
ada Maudina.
Ada siapa itu Kak?
Iya Kak. Kak mau
dari panitia Kak?
Sekarang Irfan, bukan Irfan ta? Posisi pertama, wah hebat ini.
Posisi pertama Mbak Intan ini.
Kayaknya ini Mas apa Mbak ya? Mas atau Mbak ini kayaknya memperhatikan seminar ini banget ya. Hebat loh.
Ayo yang lain. Yang lain masih di bawah ya Kak ya?
Jangan mau kalah.
Jadi nggak kelihatan. Oh, Vicky ada di urutan ketiga.
Wah, ada siapa? Belum selesai? Ya, kita tunggu dulu. Ada apa ini?
Ada apa ini?
Juga disconnect. Ya, ada apa ini? Tetap bersama. Ya. Nah, bisa ya. Nggak usah.
Tadi mungkin jaringannya ya Kak ya?
Mungkin. Ya, kita maklumin aja ya.
Siapa ya di urutan pertama?
Di urutan pertama ada Wedaning
Tias.
Ini belum salah sama sekali. Hebat memang. Memperhatikan
udah
betul.
Kayaknya.
Udah. Oh, nomor 2 Irfan.
Nomor 2 Irfan. Nomor 3 Jian.
Ayo ini apa nggak mau digantikan? 4 atas nama
Nendru.
Iya benar.
Iya. Ayo.
Yang lain
ayo. Masa salah terus?
Jangan mau kalah, ayo. Lumayan dapatnya.
Ayo, lumayan. Iya.
Oke. Kayaknya kita udah dapat pemenangnya ini.
Iya, kayaknya udah dapat pemenangnya ini.
Kita dapat pemenangnya. Ini
udah bisa ketebak ya, Kak?
Iya, lumayan. Mau dibuat beli apa ini, Kak, ya nanti?
Oh, ini
beli
permen. Oke, jadi sesi pertama sama sesi kedua masing-masing ada 3 pemenang.
Sesi kedua belum dong?
Oh iya, sesi kedua belum.
Iya.
Maksudnya sesi pertama ini kan sama-sama ada 3 pemenang. Alright. Jadi sesi pemenang pertama, the first place is siapa tuh namanya?
Siapa itu?
Erlin. Second place is
Wedaning Tias.
And the third place is
Third place?
The third place is siapa ya?
Siapa ya the third place?
The third place is
Ayo siapa ayo tadi?
Ayo siapa ayo? The third place is ya. Oh, Ipan.
Baik, nanti untuk pemenang di sesi pertama ini langsung hubungi CP yang tertera di flyer ya untuk konfirmasi door prize-nya ini lumayan. Iya. Kayaknya seru banget ya.
Iya Kak.
Satu kali lagi bisa nggak?
Bisa.
Boleh. Ya. Okay, because it look like it's fun. How about we have season 2? Gimana?
Ayo.
Ya? Ready nggak ini?
Sekali lagi ya.
Mau nggak ini sesi kedua? Dapat door prize juga sama.
Mau dong.
Tapi kayaknya kita menyimpang dari materi gitu, boleh kali ya?
Boleh.
Buat
boleh.
Ya? Iya. Boleh untuk panitia bisa di-share kuis yang kedua. Mungkin dari panitia masih menyiapkan ya?
Iya. dipersiapkan untuk sesi yang kedua.
Buat pesertanya juga harus mempersiapkan ya, karena ya itu tadi door prize-nya lumayan banget.
Iya, tentunya.
Buat beli apa tadi deh?
Dapat 100 kan lumayan ya.
Mau buat beli apa kalau kamu dapat?
Buat beli permen lah.
Dapat berapa toples itu?
Dapat berapa ya? Banyak lah, bisa dijual lagi.
Iya. Oh, dijual lagi.
Siapa juga yang mau beli permen?
Jiwa-jiwa bisnis ya kamu. Masih belum, panitia?
Oh iya, masih.
Ya,
Oke,
masih
ditunggu.
Dipersiapkan, ditunggu ya. Oh iya, kira-kira menurut kamu tuh kesan pesannya untuk seminar internasional kita ini apa sih?
Dari aku sih sangat bangga ya sama Setia Malang ini karena bisa ngadain seminar internasional ini yang diikuti oleh 900 peserta.
Wow.
Tentunya menurut Kak Ika sendiri gimana pendapatnya?
Ya tentunya excited banget lah, karena ya mengingat ini seminar internasional pertama kali di sini. Ya tentunya kebanggaan tersendiri untuk Setia Malang dan Himari seperti itu.
Iya, cukup bangga.
Iya.
Apalagi alumni-alumni pasti juga ikut bangga.
Iya benar banget. Kayaknya ini udah mulai deh kuisnya.
Oh iya. Udah berapa ya yang gabung ya?
Belum ya? Oh, udah banyak lumayan. Caranya tetap sama.
Iya, caranya tetap sama.
Gimana caranya?
Langsung masukin kode aja Kak ya.
Iya, joinmyquiz.com. Kemudian masukkan kode gamesnya. Kira-kira dari panitia di share link juga apa enggak ya ini? Iya, bisa langsung klik ya, itu langsung join. Ayo jangan sampai ketinggalan, ini gamesnya nggak ada hubungannya sama materi yang tadi. Santai-santai aja.
Santai-santai aja.
Mungkin bakalan lebih susah sih, tapi nggak apa-apa ya, kita lihat.
Iya.
Ada berapa ini yang join? 120.
Udah 100 lebih Kak.
Wih, excited banget ini teman-teman semua ya.
Iya.
Kita tunggu sampai 200 apa bisa lebih nggak ya kira-kira?
Bisa lebih deh kayaknya, bisa
Iya.
lebih.
Kayaknya semua pada
Itu udah 150 lebih.
Iya, 157,
157, 159. Ayo lebih dari 200.
Bisa
kalau
nih,
bisa.
Yuk, bisa yuk.
Yuk bisa yuk.
Bisa.
Udah 170. Ayo teman-teman yang lainnya.
Ini kayaknya lebih cepat dari yang tadi ya.
Iya.
Yang tadi itu masih ragu-ragu gitu. Sekarang udah yakin semua. Jangan sampai ketinggalan. Ikutin.
Ayo, udah hampir 200 nih Kak. Ini 200 pas atau bisa lebih?
Kalau bisa lebih nggak apa-apa kali ya, lebih seru.
Oke. Bisa lebih?
Kalau
udah 200 ini loh.
Udah 200.
Oh iya, lebih. Berapa ya?
Sama atau gimana?
Berapa?
Door prize-nya sama atau beda sih?
Gimana ya enaknya?
Tenang aja, door prize-nya masih sama
Tetap
walaupun
sama.
di sesi kedua.
Iya.
Makanya jangan sampai ketinggalan. Udah, berhenti. Kayaknya kita mulai.
203 ya?
Oh, di sini. Oh iya.
Oke.
Kita mulai aja ya kuisnya.
Ya langsung dimulai aja panitia ya.
Ayo monggo panitia silakan dimulai. Apa masih tambah? Oh.
Oke.
Kita hitung ya, mulai dari 5,
4,
3,
2,
1. Ini mana?
3, 2, 1. Go. Ayo
Ini ada.
siapa tuh Kak?
Hana Lutfia dari Poltekkes.
Oh.
Terus posisi
di
kedua.
urutan pertama ya Kak ya itu?
Iya,
ya?
di urutan pertama. Hebat banget. Udah bener aja ini pertanyaan pertama ya.
Urutan kedua siapa tuh Kak namanya Kak?
Urutan kedua atas nama Novita Amalia dari Udinus. Oh, sekarang udah di ini.
Iya, udah tersusul Kak, udah tersusul itu.
Terus.
Siapa tuh Kak yang urutan pertama Kak?
Sekarang urutan pertama ada Christine.
Oh,
dari mana ya Christine ini?
Urutan keduanya
ada Asep Yuki.
Asep Yuki
ini dari mana juga? Masih bertahan ya?
Masih bertahan. Oh, tersusul.
Nggak mau
Siapa
kalah.
Febri? Febri Triwulandari.
Kayaknya yang lain
Oh,
nggak
jadi
mau kalah.
tertinggal.
Iya.
Siapa tuh, Kak?
Ini
Urutan
ada
pertama.
Urutan pertama ada Dina Handindari.
Oh, Dina Handindari.
Urutan kedua ada siapa ini? Imam Aldi Syafi'i.
Ya. Oh, akhirnya tersusul juga oleh teman-teman yang lain.
Gimana nih soalnya? Mudah-mudah kan? Nggak ada hubungannya ini sama materi.
Iya, nggak ada hubungannya sama materi hari ini.
Iya, makanya. Ini siapa? Muhammad Ramdhani. Wah, hebat banget, nggak ada yang salah. Kayaknya ini sering
Siapa
banget.
tuh, Kak? Yang urutan kedua, Kak?
Urutan kedua ya.
Udah kelihatan belum sih yang menang siapa?
Kelihatan kayaknya ya.
Tapi kayaknya banyak yang salah deh, Kak, itu.
Iya, enggak, ini Muhammad Ramdhani ini enggak pernah salah.
Oh
sekarang
sekarang salah.
Kayaknya sering nonton tebak-tebakan ini. Hebat-hebat.
Urutan kedua tersusul oleh siapa itu, Kak?
Ada Viana.
Viana.
Urutan ketiga ya
Urutan
Nita
ketiganya?
Sri. Iya,
Dan urutan pertamanya masih tetap bertahan.
Iya, sama mengingatkan ya untuk peserta jangan lupa mengisi link absensi kedua. Tuh, jangan sampai ketinggalan juga ya. Ada yang tanya pos tesnya mana?
Oh, ada minta pos tesnya.
Pos tesnya ada di link absen kedua ya.
Ini mah udah kelihatan, Kak, ini mah.
Kayaknya udah kelihatan ini
Siapa
siapa yang
pemenangnya?
menang. Hebat ini Muhammad Ramdhani. Pengen tahu nih orangnya yang mana ya?
Iya nih, pengen
Masnya
tahu
ini.
nih. Urutan keduanya siapa ya, Kak, itu, Kak?
Linknya belum ada. Untuk panitia mungkin bisa di-share linknya sekarang. Itu udah.
Oh iya.
Silakan mengisi link absensi kedua.
Wih, masih bertahan. Yang urutan pertama.
Iya,
urutan keduanya
hebat
siapa
banget.
tuh, Kak?
Urutan kedua ada Devi. Enggak jadi.
Tersusul.
Disusul sama Reka. Baru Devi di urutan ketiga. Hebat-hebat ini peserta ya.
Muhammad Ramdhani itu ya, Kak?
Iya.
Masih bertahan di urutan pertama loh.
Masih bertahan, nggak ada yang bisa ngalahin
Hebat,
loh.
hebat.
Hebat banget.
Ayo, siapa yang bisa mengalahkan Muhammad Ramdhani ini?
Ayo gantikan posisinya.
Aprilia Nurlaili di urutan kedua.
Iya, sama Reka di urutan ketiga.
Ayo yang lain.
Ayo, sambil diingatkan lagi ya untuk mengisi link absensi, jangan sampai ketinggalan.
Iya, jangan lupa.
Berubah-berubah Pak, udah selesai nih. Oh masih
Masih
ada.
berubah, Kak, itu, Kak. Cuman yang bertahan ya itu, yang urutan pertama.
Ya kayaknya Mbak Reka masih
Ya.
salah satu.
Oh, tersusul, Kak.
Oh, ya ampun Muhammad Ramdhani.
Tersusul sama
ini.
siapa ya, Kak, itu?
Masnya dikalahkan sama Mbak Erika ya.
Sama siapa, Kak, itu, Kak?
Mbak Erika di posisi
Mbak
pertama.
Erika. Oh, tersusul lagi, Kak.
Oh, ternyata.
Oh, jadi Muhammad Ramdhani ini jadi urutan ketiga.
Iya. Mungkin lupa ya, lupa sedikit gitu kemarin apa gitu ya. Lupa mungkin. Sekarang di posisi
siapa?
keempat digantikan sama Devi.
Siti, siapa
Iya,
tuh, Kak?
Siti Zulaika.
Zulaika.
Di posisi pertama. Ini posisi masih bisa berubah ya. Gimana, udah ya? Kayaknya udah deh, kelihatan siapa yang menang.
Iya, kelihatan.
Kelihatan sepertinya siapa yang menang ini ya.
Udah kelihatan, Kak, ya?
Kayaknya.
Jadi urutan pertama siapa, Kak, itu? Siti Zulaika ya?
Iya.
Oh, belum
sebentar.
selesai gamenya, belum selesai.
Gamesnya.
Masih berjalan terus. Oh, udah selesai. Siapa pemenangnya?
Okay, the session 2, the first place is
Rizky
Rizky
Dwi
Dwi Saputra. The second place, siapa itu? Siti Zulaika. The third
Iya.
place,
The third place is
Eriska. Iya, hebat banget ini. Sering main kuis tebak-tebakan gitu ya kayaknya. Iya, benar banget.
Jangan lupa teman-teman yang tadi telah disebutkan namanya untuk menghubungi CP yang tertera pada flyer untuk mengkonfirmasi door prize-nya.
Iya, benar banget. Jangan sampai lupa konfirmasi ntar door prize-nya nggak dapet, kan sayang ya. Oke. Because the time is up, it's time for us to resign. Thank you for the participation. We return to MC. Thank you.
Thank you.
Okay, thank you for Dea and Ika, and thank you for participating in the International Seminar 2021. Hopefully, what we got can be useful for all of us. On behalf of the committee, I would like to thank you for your participation, and we apologize if there are any mistakes during the course of this event. Good afternoon, and see you in the next event. Wassalamualaikum warahmatullahi wabarakatuh.
Ya, untuk partisipan dimohon untuk tidak keluar Zoom ya, karena akan ada live musik dari Rumpun Seni Setia Malang. Jangan lewatkan penampilan hebatnya. Welcome and enjoy the performance.
Thank you for following the event to the end. Have a good day and happy weekend. need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worst. 'Cause only you, nobody knew I put you first. Girl, I swear I'll do the worst. Let me hold your hand. I can feel those places in your hand as it can. Let me squeeze your love, for I don't pretend. I'll be like you, baby, you mustn't go sweet. Don't you worry, I'll be there whenever you want me. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause only you, nobody knew I put you first. And for you, girl, I said I'll do the work. Somebody who can love me at my worst. No, I'm not perfect, but I hope so in my world. 'Cause only you, nobody knew I put you first. And for you, girl, I said I'll do the work. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause only you, nobody knew I put you first. And for you, girl, I swear I'll do the world. I need somebody who can love me at my worst. No, I'm not perfect, but I hope you see my worth. 'Cause only you, nobody knew I put you first. And for you, girl, I swear I'll do the work.
Lanjut lagu kedua ya. Yang kedua lagunya It's You dari Sezairi. Though I try, 'cause you look amazing. I'm sorry for all the right cause before today I knew my favorite. So take my hand now, see me, 'cause you let me into this day. Love is our tears.
Untuk lagu yang terakhir, lagunya Here You're Perfect. Sebelumnya kami mengucapkan terima kasih kepada Himaris yang telah mengundang kami untuk perform di acara seminar internasional ini. Dan lagu yang terakhir ini, lagu untuk perpisahan untuk mengakhiri acara seminar ini. Terima kasih semuanya. Selamat mendengarkan. Happy weekend.
that I feel for you. And I'm scrubbing around, but I still can't forget if I wanted to. And you told me you said to come here and join them everywhere I go. It's all in my head, it's all in my head. Crossing your pocket, saying it is a mistake.
Soon my troubles away, one more glass of champagne. And you know I'm the first to say that I'm not perfect, and you're the first to say you want the best thing. I know I'm perfect when you let you go. Give my last hello, hope it's worth it. I'm the first to say you want the best thing. I know I'm perfect when you let you go. Give my last hello, hope it's worth it. For you, when I was crossing the river, I still can't forget if I wanted to. Tell me I'm sinking, breathing your name everywhere I go. It's all in my head, it's all in my head. Was in your pocket, saying it is a mistake. So my troubles away, one more glass of champagne. Can't you know I'm the first to say that I'm not perfect? I know you used to say you want the best thing. I know I'm perfect when you let you go. Give my last hello, hope it's worth it. I'm the first to say that I'm not perfect, and you're the first to say you want the best thing. But no, I'm perfect when you let you go. You're my last hello, hope it's worth it. But no, I'm perfect when you let you go. You're my last hello, hope it's worth it. Send you a pocket, saying it is a mistake. Threw my troubles away, one more glass of champagne. And you know I'm the first to say that I'm not perfect, and you're the first to say you want the best thing. But no, I know I'm perfect when you let you go. You're my last hello, hope it's worth it. So perfect when you let you go. You're my last hello, hope it's worth it. It's your perfect. Terima kasih.
Aku mengerti perjalanan
Recording stopped.
hidup yang kini kau lalui. Ku